We've got folks working on improving chronic disease. I'm really excited to see, for example, the push to think about finally banning or limiting flavored tobacco, which drives a lot of the black-white life expectancy gap. I'm pleased to see progress in terms of connecting patients to care, so that they are in the preventive care that helps keep them from developing the more seriousness, and we will be doubling down on these efforts. So my promise to you as we look ahead as a city is that the health department and the city of Chicago are on this. I have teams looking at this data and using this data to drive resources where they are most needed 7 days a week, literally around the clock. We're pushing testing, resources, education, investigation where it is most needed week after week. We're working with the Race Equity Rapid Response Team with uncountable numbers of community and healthcare partners. And we've managed to keep this as one response so far. We will continue to safeguard our progress. We've not been shy about that. You heard the mayor talk about the enforcement that's been happening, where we've seen businesses that have not been stepping up and doing the right thing. We've put the travel quarantine in place. That is about protecting our progress here. We will not hesitate to make additional changes at a city level if we need to. But the best way and the biggest predictor of our progress here is not something that I can do or the mayor can do or Chicago can do. It's whether we as a city continue to do the behaviors that got us down to a moderate high risk, a moderate high incidence. I want to see that continue to drop. I know you all at this point know the things you need to do. And I ask you, please, to keep doing the things that have worked. We'll keep the things that have gotten us this far, and together we can be safe Chicago. Thank you.
Happy to take your question.
Mayor, good morning. Chris Ty from CBS 2. A couple questions from our news organization first. As the mom who's not going to just turn the car around, but turn it off, the headline here today has been 18 to 29-year-olds and that we're teetering on 200 new cases a day. Can you talk at all about any policy that may emerge to be new tools in your toolbox to help attack in the near future?
Well, I think as Dr. Arwady said, we're watching every day very closely a number of different metrics, including new and where they're coming from. So part of what we've been doing as we started to see this increase, really that started a couple weeks back, is thinking about how do we really reach this age cohort. Difficult to do because think back to when you were that age, we all thought we were invincible. But we've been thinking strategically about where do this group of folks gather? What are the places where when they leave their home outside of work that they're at? So we've been placing a lot of emphasis on restaurants, bars, gyms, other places of entertainment, and really enforcing the message there that everyone who enters those premises absolutely must wear face coverings. Everyone who enters those premises must engage social distancing. But that's clearly not enough because we're continuing to see those cases. So we will be rolling out here shortly a specific targeted campaign to reach that demographic, the age demographic, but also targeted based upon race, ethnicity, and so forth. So we've got to keep bringing that message home. That's a big reason why we're standing here today. We hope that we don't have to take closure steps. But as the doctor said, and is now, I think, well known across the country, bars in particular pose a particular challenge. We've emphasized to bars, we're not around. You've got to follow the guidance. We've cited a number of different bars because they haven't followed that guidance. And just last weekend, we shut one down. We shut down I won't call it what I call it internally, the boat, because clearly they weren't taking things seriously. But we really need individuals in that cohort to understand that this disease does not discriminate. It attacks everyone, and right now the target is 18 to 29-year-olds.
Dr. already said the first she looks at every day is in the top left corner of that dashboard, and we're teetering on 200. We're likely, in her words, to get there again.
Yes.
Would that be the threshold at which point you would say we need to back the bar policy? Is that a binary thing?
It's not that simple, although, again, 2 is a number that we're very concerned about, which is why we're calling this out now. But as Dr. already said, there will be a number of different factors that roll up into that. It's not purely the case number, although that's important. We've got to look at where are the new cases coming, where are the areas that we're seeing those new numbers being generated, the demographics of the individuals in the new cases, if there's a particular kind of gathering that is producing these new cases. So it's more nuanced as you would expect than that. But yeah, 200 is an area, if we breach that and go over it consistently, it's going to be an issue of great concern to us.
A lot of questions, my colleagues. This is from Ryan Burrow at WGN Radio. Has the city issued any citations related to violations of the emergency travel order? How is the order being enforced?
Well, as I've answered this question on several different occasions, we looked at, as our model, other states, particularly on the East Coast, that had imposed this. And what we heard from them is that they had a substantial compliance rate. Now, are we going out and finding people that are coming from other states that are here in Chicago not quarantined? No, we are not, and we will not. But we will do to educate people into compliance. It's very important that people understand if you are coming from one of these states, and we just added 2 more yesterday, Iowa and Oklahoma, your case numbers put you at risk. And the best thing to do is really to stay in place. But if you have to travel and you're coming to Chicago, we do want you to quarantine. Dr. Opine a little bit more on that.
I'll just add, to put that in some context, this that we've put that quarantine requirement on are states that have the equivalent of more than 400 cases per day, or what that would look like here in Chicago. So they're places that have an outbreak, at least sort of as many new cases as we're having here. And it's really, and in some cases, as much as 8 times the cases that we're having here. So if you look at Florida, you look at Arizona, they are, I think, even just being in those states, frankly, is a significant concern for contracting COVID. Related to enforcement, I would say where we, first of all, again, thinking a little bit about the 18 to 29-year-olds, where we compare what's different about that group. We do case investigations of course cases. We know that that group also travels out of state, actually, more than any other group. And that was happening prior to us putting this order in place, but that's an example of where we say, look at the data, where are we seeing cases, what is different about that group. One thing that was quite different about that group was they were more likely to travel out of state. Again, not surprising based on the age group, but if there's a way that we can structurally think about limiting that risk, we're going to take that example.
While I have you, a question from A.D. Quigg from Cranes. It appears testing numbers have fallen since July 9th. What's driving that?
No, testing numbers have not fallen since July 9th. One of the things that can be a little confusing, and if we look at this, if you're looking there, is that in the last few days, there are delays in terms of when the test results come in. And so if you look at how we actually report tests, we don't use the last 5 days or so, because we never get a test result on the same day that it's done, and it's unusual for us to even get it the next day. In most cases, we're getting it 2 to 3, but sometimes up to 5 or 6 days later. And so we never include those last few days in terms of our case numbers. Overall, our testing numbers, I should say, are really the highest that they've been and continuing to grow.
Okay, thank you. Mayor, this from Alex Keefe at WBEZ. Said yesterday that CPS may not announce reopening plans until late August.
No, that's not what I said. Let me just be clear, because I think there's been some miscommunication about that. What I said is that soon CPS will announce a framework and start a more robust, just to be clear, because I think there's been some miscommunication about that. What I said is that soon CPS will announce a framework and start a more robust discussion. The moms from our school last night, and the primary discussion was what's going to happen with schools. I know that this is a conversation that, of course, parents are anxious about, they want to know about. I understand it completely as the mom of an elementary school child. That's why CPS is going to be starting this conversation now in order to get the views and the reactions of parents, teachers, staff. Everybody in the school community needs to be part of this discussion so we come up with a range of options and flexibility in the event that we are all able to open school.
And I guess the essence of this question is making sure parents have enough time to plan. Is that factoring into this discussion?
100%, which is why we're starting this discussion now.
Kelly Bauer at Block Club. It's been said cities need to keep their positivity rate or below 5% to get kids in school. Chicago's already at 5%. Will officials look at closing businesses like bars or taking steps back to prevent further spread so kids can be back in the fall? And you've kind of answered that.
Yeah, I think we've addressed really both of those questions.
She also asked if cases continue to rise, would Chicago automatically revert back to stay at home as other cities have, or would we merely close some businesses again?
And I think we've addressed that question as well. We are looking every single day at a range of different metrics, including new cases, and if we see an uptick, if we go above 200, of course we're going to be interested and concerned about what's driving those numbers, and then we will take measures as appropriate to address particular areas where we're seeing the cases, new cases coming from.
Fran Spielman at the Sun-Times. You've joined a group of mayors in a letter urging Congress to approve replacement revenue to cities and warning of the dire consequences if you don't get it. What exactly are those dire consequences?
Well, I mean, I think everybody knows what those are, but our hope is that we will get new relief from the federal government. I've spoken recently with Senator Durbin, for example, along with a mayor of another city that's much smaller than Chicago. We've talked about the impact of the closing the economy on local revenues, on our budgets, and that we desperately need new resources from the federal government that we can use for revenue replacement. The CARES Act money, which is extraordinarily helpful, but that is only money that can be used specifically for COVID-19 response. What we need, all of us, of cities and villages of all sizes, is resources to help us address the revenue shortfalls that have arisen as a result of the economic shutdown.
Last two questions.
Okay, let me bounce around. There's a few others. Our friends at CBS Network have a question. There's growing concern that air conditioning systems can play a role in spreading the coronavirus as it heats up here, as it remains hot here. Are you concerned? And if so, what are your main worries?
I'm going to defer to the doctor on that question.
So most of the information that we have related to structural things that can potentially drive COVID spread are more related to ventilation as compared to air conditioning. So there is very specific guidance that the CDC has put out and that CDPH and the city have pushed out, particularly to larger businesses that would have large-scale ventilation or air conditioning systems in place. The bottom line is you want to do what you can to increase air exchanges with the outside. And so our big buildings here in Chicago have done that. At an individual level, I want to address this because I think particularly with the heat and with, 25 years post, our really significant heat wave here, I want to be clear that it is safe and appropriate for individuals to use air conditioning in their apartments or in their homes. I am not concerned about a window air conditioner or an air conditioner in a residential setting being a source of COVID spread. I would apply the same guidance that we give to the large buildings to individuals, that a really good way to decrease any potential risk of COVID is just to open your window, open your door, have additional airflow running through your apartment or through your home, and broadly letting the outdoors in is has turned out to be one of the more important things for limiting the risk of COVID in buildings. So I don't consider air conditioning the major concern.
Thank you. Mayor,
Last question.
I understand this is the last question. If I can just ask one about CPD and one about CTA. This is from Mike Lowe at WGN. What is your level of concern about the 10 positive cases at the Police Academy? Should CPD consider moving most Police Academy training online? And one from John Greenfield asking, we're seeing a spike in crime on the CTA with at least 8 violent robberies on Redline platforms. Last February, on the day you announced an increase in policing on CTA to combat crime, officers were shot and critically wounded. Would you consider a new program? So one on CPD, one on CTA.
Well, we follow, I'll take the CTA question first. We follow what's happening on the CTA very, very carefully, and we made specific structural changes to address what had been a 3-year uptick in crime on the CTA. I think those new changes that we put in place, much more accountability on the part of officers and supervision, have actually served us well. Obviously, anytime we have crime anywhere, it's a concern, and we'll continue to work with the CTA as well as the CPD to make sure that all of our train travel is safe. Regarding the cases, look, the reality is no setting is risk-free, and we've been relatively fortunate here in Chicago about the amount of spread that we've seen among our first responders, and while we lost, I believe, 5 first responders in the early days of the COVID spread, which is obviously a terrible tragedy for the individual families, and been very hard on both the fire department and the police department. I think what we've seen in recent weeks and months is a significant decrease in the amount of new cases amongst our first responders, fire and police, and we haven't had any reported deaths related to COVID in quite some time. That's because both of those departments have spent a significant amount of time working with the Department of Public Health to implement testing and training and education for individual members to teach them how to keep themselves safe, to make sure that they've got the equipment they need to be able to do their jobs. And I've been extremely diligent in pushing both the fire department and the police department to make sure officers who are coming in contact with members of the public have the proper equipment that we provided them, that they're actually using it.
And a quick follow-up, if I can, related to CPD. This is from Amy Jacobson at WIND. Yesterday, CWB Chicago released a video of the census cowboy making disparaging remarks about Chicago police. Have you seen that? And are you going to keep him as a volunteer, reprimand him, or let him go? Well,
I saw a video from April. And look, the reality is what we're trying to do is raise the heightened awareness around the census. That's the most important thing. And we're going to be doing everything that we can to make sure that people understand the importance of the census. There's a lot of other things that we're going to, and tools that we're going to employ to raise the consciousness of folks in the census. This could not be more important. A lot of the things that we're talking about, and you asked a question earlier about revenues from the federal government. If we are not counted, we do not get our fair share of dollars from the federal government. Pure and simple, everyone needs to be counted. We need to raise our rates above 55% where we are now. We still have some time to be able to do that, and we're going to be using a lot of different tools to make sure that people understand 5 minutes means resources to Chicago for schools, for roads, other infrastructure, the things that are important to us to build a great, strong, vital economy. The census is the gating tool.
So
Thank you, Mayor.
Will you keep him or reprimand him?
Thank you, everyone.
Stolen four-wheelers at the center of a months-long investigation, and local authorities say the thieves are crossing county and state lines. But we begin tonight with the latest details in our fight against COVID-19. In the last 24 hours, nearly 3,400 new cases of the virus have been reported statewide. Good evening. I'm Courtney Bryant.
Thank you so much for joining us. I'm Tom Haynes. About 23% of all of those new cases come from 4 counties alone: Gwinnett, Fulton, DeKalb, and Cobb. Tonight, there are currently more than 2,700 people in the hospital battling the deadly virus. Since yesterday, 28 people have died. For the first time, data reveals that 1 in every 10 Georgians have tested positive for the virus since the pandemic began. Tonight, a huge step forward in our fight against COVID-19.
This evening, researchers at Emory University reported anxiously awaited findings from phase 1 of the first human trial for a vaccine. Fox 5 anchor Christine Spiro joins us now. And Christine, these results are encouraging to say the least.
Yeah, that's right, Courtney. Scientists say after getting the shot, patients produced antibodies to fight coronavirus. Now the question is whether it will protect against infection and how long those antibodies last.
It has also shown that the vaccine is able to induce a good immune response.
Emory, Kaiser Permanente, Washington, and the Vaccine Research Center at the NIH are testing this experimental vaccine made by the biotech Moderna.
Within 6 weeks, they actually had a vaccine that was ready to be given in humans. And by mid-March, we had the first subject enrolled.
A 65-year-old Decatur man was one of the first enrolled to test this experimental vaccine.
So the vaccine is 2 doses. One is given now, and again, another dose in 4 weeks.
Local trial participant Norman Hume received the first injection in April, then the second in May.
Kind of getting a flu shot. They just kind of put in your, the arm of your choice in the upper deltoid muscle. So I have to keep a diary of any other thing, like pains or headaches or any nausea.
Have you had any of those issues?
No, I haven't.
Unlike Hume, researchers say more than half the study participants reported flu-like reactions to the shot.
As far as side effects, we've seen the subject mentioning pain at the injection site, but also mentioning some systemic symptoms such as feeling fatigue, having some chills, having some headaches.
Some of those reactions are similar to coronavirus symptoms, but they're temporary, lasting about a day and occur right after vaccination. Overall, scientists say they're pleased the vaccine provided a hoped-for immune boost.
We were pleasantly surprised that the vaccine was well tolerated. I think we were also pleasantly surprised that it did induce an immunity similar to convalescent people that recovered from the disease.
Now, phase 2 is still ongoing, and phase 3 will start around July 27th. It's a 30,000 person study to prove if the shots are really strong enough to protect against the coronavirus. If you're interested in participating in the vaccine trials, we've provided a direct link to our website. Just go to fox5atlanta.com. Courtney?
Fascinating stuff, Christine. Thanks. Allegations of falsifying COVID-19 tests at an Athens Clark County hospital have been cleared. 4 nurses filed a lawsuit against the Landmark Hospital of Athens, claiming administrative staff retested patients who had already tested positive and sent them to a lab. An investigation by the state found the hospital did nothing wrong.
New tonight, an Atlanta area church chooses to close its doors for in-person worship for the rest of the year.
The pastor of North Point Community Church made the announcement on the church's Facebook page. Fox 5's Brooke Zahner spoke to him about his decision.
Like many other churches, North Point Community Church has been reaching people solely online since the coronavirus pandemic. They had planned to open their buildings up this summer, that is, until coronavirus cases started going up.
Our churches have not closed. We've simply suspended gathering on Sunday morning at 9 and 11 o'clock.
Pastor Andy Stanley says the choice to keep North Point Community Church's buildings closed through 2020 was not a hard decision to make.
And everybody agreed we cannot do contact tracing. We cannot guarantee the safety of everybody who comes in the building.
Since the start of the pandemic, North Point has been reaching people online and over Zoom, even in people's driveways and the church parking lot.
I didn't have to talk anybody into this. They were like, no, that's not what we're about. We are outward facing, so let's outward face and do things that we've not had an opportunity to do before.
The announcement came in this video to the church.
We've decided to suspend in-person adult worship services for the remainder of the year.
Pastor Stanley acknowledges not everyone is happy about the decision.
For others of you, this seems like an unnecessary precaution, perhaps a lack of faith on my part.
In a non-COVID-19 world, thousands of people attend church at one of North Point Ministries' locations. They say they will do small gatherings, but trying to bring people back to the building isn't a good idea for them.
We're going to do some limited physical gatherings between now and Christmas for sure, but we're just not going to open up our buildings, primarily because our responsibility is to keep people safe.
Stanley says he sees this time as an opportunity to reach more people and help the community.
We're committed to doing things for our community. And if we open, we may accidentally do something to our community that's not positive.
At this point, in-person services at North Point Community will resume again in 2021. For now, Stanley says they will continue to reach people virtually. Reporting in Atlanta, Brooks Honor, Fox 5 News.
Developing tonight, the Trump administration has reversed its decision that would have forced international college students to leave the U.S. if they were only taking online classes this fall. The unexpected announcement from ICE came just as arguments were set to begin during a court hearing. Several states and universities had filed lawsuits against the government to block the rule. Many students will be taking all online classes in the fall, and now some parents are scrambling to find tutoring and other resources.
And as Fox 5's Deidre Dukes explains now, they're worried their children will suffer academically without in-person instruction and are now looking for additional support.
Clayton County School Superintendent Dr. Morsees Beasley took to YouTube Tuesday afternoon to detail the school district's plan to help ensure families are ready for virtual learning when classes begin August 10th. Clayton and Atlanta Public Schools among the metro area school districts opting to begin the year with virtual instruction. Fulton County Schools has offered parents the choice of sending their children to school or to learn online at home.
It's leaning for me towards going virtually, but while, if I lean towards going virtually, I have to have some type of assistance with my kids.
Carla O'Denny's children attend Fulton County Schools. Like so many other parents, the mother of two and her husband struggled with the demands of homeschooling last spring.
It was frustrating. Many days I felt like I just didn't know what I was doing. I was emailing teachers, just trying to see what schoolwork needed to be turned in, what resources we had, how should I be helping them.
The O'Dennys are now searching for a tutor for their kindergartner and 8th grade student to help bridge the gap.
And having a tutor, somebody who may have an education background and could best help my kids.
All parents are being faced with something they never thought that they'd be experiencing.
Felicia Zorn, who is Director of Business Development for USA Test Prep, encourages concerned parents in search of a tutor to reach out to their student's school for recommendations.
There are systems and school districts out there that have lists of tutors that are available that are former tutors or retired teachers.
Zorn says there are lots of online resources available to help students and parents. Websites like USA Test Prep have content that align to the state standards and allow parents to track student success. Deidre Dukes, Fox 5 News.
And this breaking story just into the Fox 5 newsroom. The attorney for Justin Conley tells Fox 5 that Atlanta police have notified him this morning. They have 2 warrants for the 19-year-old's arrest. One felony murder, the other aggravated assault. This is all in connection with the death of 8-year-old Socorria Turner. You may remember Fox 5 spoke with Justin Conley earlier this week. The teen admitting to Fox 5's Angelique Proctor he was present during this crime but did not fire his gun. He also says he witnessed the shooting. Conley's attorney says his client plans to turn himself in today. Stay with Fox 5 for the latest developments on this case and for the 8-year-old's funeral today. All right, CDC says it's time to mask up, like for real this time. In an editorial in the Journal of the American Medical Association, 3 top leaders at the agency say everyone should be wearing a face mask in public. The Fox Medical team's Beth Galvin joins us live now to talk about this. Beth, why such a strong stance now? Good morning.
And good morning, Caitlin. Well, I think for a couple of reasons. One is this surge that we are seeing in cases, a tremendous surge across the South and across the western part of the United States. And also because there is growing evidence, Caitlin, that masks may not just protect, we may not just be wearing a mask to protect other people. They may actually offer protection to us too from getting seriously ill. And there's this super interesting case out of Missouri that we're going to talk about. But I think that there's also this evidence that is growing of asymptomatic spread, Caitlin. So people who do not feel sick, who have no symptoms, who are just going about their lives not aware that they are positive for this virus or they've contracted this virus, who may be spreading the virus to other people because they don't feel sick. So we have a few things going on. We've got the surge, we've got the growing evidence masks may work, and we've also got the asymptomatic spread spread that might be driving much of this outbreak that we're going through. Caitlin?
And the CDC, Beth, just published a case, right? That case study that drives home how much difference masks can make. They're pointing to a story out of Missouri, right?
Yeah, so this is out of the Springfield area, a great clip salon, and I think you might remember this in May. It was a big news story. A couple of stylists who, as a part of the reopening, came back to work, were working and were wearing masks. The customers were wearing masks. Everybody was wearing masks. They got sick. And they still came to work. One got sick and was sick for about 8 days and continued to work. She infected her coworker, apparently, who continued to work for 4 days. So in all, we've got the numbers here. We had 2 stylists who exposed 139 clients, Caitlin, and 6 of their coworkers. All of those folks, though, in that salon, under the state rules of the reopening, were wearing masks. So 47% had on a cotton mask, like most of us are wearing. 46% had on a surgical mask, and 5% had on one of those N95 respirators, a medical mask. Well, the customers, and they were with their with these sick, symptomatic, coughing, respiratory issue stylists for about 15 to 45 minutes. So the CDC went in and followed with local health investigators, followed what happened to these folks. And this is where it's really interesting, Caitlin. If you follow up with them, of the 139 people who were exposed, none of them developed symptoms. 67 of them volunteered to be tested for COVID-19. All of them tested negative, not one positive test in the group. So we're talking about, Caitlin, 139 people who were exposed to somebody who was symptomatic but wearing a mask. They were wearing a mask. None of those people, according to the CDC's report, got this virus. So it's just really showing that maybe there is a role, and maybe the masks protect both ways, not just the wearer wearing it to protect other people, but it protects you too from wearing it. But I think the key, though, is that we've all got to be wearing it because you got to have protection on both ends.
I guess this is all a learning process as we go through this, right? And right now that the stay-at-home order has been lifted, we're seeing more people out and about, many with masks, all different sorts, some without, though. A poll has been tracking how people feel about masks since this all began back in March. How did people feel about the mask during the surge, during the spike?
So it's interesting. It's been growing each week, the number of people who say they've worn a mask in the last month. And this is a Gallup poll, or in the last week, rather. This is a Gallup poll. And right now, they're saying the vast majority of people are wearing a mask at some point. 44% saying they're always wearing a mask when they go out in public. 28% very often wearing a mask. And about 30% say they sometimes or rarely or never wear a mask when they're out in public. And interestingly, it has to do with sort of gender and where you live and your income and things like that. But women are more likely to wear a mask. Democrats are more likely to wear a mask. And people in the Northeast, where you are from, Caitlin, are much more likely to wear a mask than people in the South. And it kind of, the survey is showing, this kind of growing political divide about masks that we're seeing. And, a lot of people are seeing out there that it kind of goes along party line. Republicans less likely to wear a mask, Democrats more likely to wear a mask. And I think it kind of depends on whose message you're following in all of this. A lot of confusing messages at one time. Caitlin?
I guess all I'm noticing, Beth, is how stylish some masks are.
I know.
Jealousy.
It does help make wearing a mask a little easier, yes.
Thanks so much, Beth. Beth Galvin reporting live for us.
Okay, good afternoon, everyone. This is Susan Chana again with Emory University. Today we are going to be discussing the early results of a vaccine trial that we've been working on at Emory. We are one of 2 sites in the U.S. It is in conjunction with Moderna and NIAID. And today we have with us Dr. Nadine Rufiel, and she is the interim director of the Hope Clinic and associate professor of infectious diseases at our Emory University School of Medicine. And she is the principal investigator for Emory's Vaccine Treatment Evaluation Unit, VTEU, and this is where the vaccine trial is actually being conducted. I'm going to turn the briefing over to her, but as a reminder, please be sure that your systems are on mute. Many of the people on this broadcast will use it for later on for broadcast. And if we, following her briefing, we will take questions via the chat function. So please feel free during any time to start entering in your questions into the chat function. Dr. Rufial?
Yes, thank you, Susan, and hello, everybody. So today it's exciting. At 5 o'clock, exactly 2 minutes ago, New England Journal of Medicine will release the prelim results of the mRNA Moderna NIH collaboration, which is a candidate for COVID vaccine. And then basically this is a phase 1, first in human. It started mid-March. It had enrolled many subjects. Those prelim results focus on the first 45 that were enrolled in 3 different doses, the 25 micrograms, the 100 micrograms, and the 250 micrograms, and a study population of 18 to 55 year old. And it had shown that the vaccine was well tolerated. It has also shown that the vaccine is able to induce a good immune response. And that's kind of the promising
This call is being recorded.
The phase 2 is still ongoing, and the phase 3 for this particular vaccine candidate will occur later this month.
Okay, we can go ahead. Dr. Rufial, do you want to provide us with any additional background as to when we started this whole process as we wait for questions to come in?
Yeah, sure. I mean, this is, as far as vaccine goes, this is an extremely speedy timeline. Once the sequencing of the vaccine was found, immediately Moderna, in collaboration with NIH, start working on the vaccine candidate. And basically, within 6 weeks, they actually had a vaccine that was ready to be given in humans. And by mid-March, we had the first subject enrolled. And for those 45 subjects, they were all enrolled within the first months. So that only took between mid-March to mid-April. And, you know, to be able to publish those prelim results just 3 months after completing the enrollment of those 3 cohorts is really unprecedented.
We'll go to our first question. What can you tell us about the length of immunity and what are the side effects of the vaccine?
So the vaccine is 2 doses. One is given now, and again, another dose in 4 weeks. Most commonly, the side
children in low-income communities.
So as far as side effects, we've seen the subject mentioning pain at the injection site, but also mentioning some systemic symptoms such as feeling fatigue, having some chills, having some headaches. We've seen the side effects mostly with the second dose compared to the first dose. And then to go back again to your point, as far as the duration, probably not much. I mean, again, we really had shown the antibody and the safety result up to 2 weeks from enrollment. So we cannot say much about the safety of the vaccine at 6 or 12 months, just time will tell, or the duration of the immunity.
Dr. Rufial, the next question, how many of the phase 3 participants will be from the Emory site? Will they be from Georgia or other states?
Yeah, there will be hundreds of subjects that are enrolled between the whole clinic, between the Emory Children's Center and the Ponce de Leon clinical research sites. And that they will also be hundreds of sites across the US. So there will be opportunities for participants here within Atlanta to participate, but we're also trying to really engage the community at large within the state, and particularly communities that have been hit the hardest with COVID. That's the African American community and the Latinx community.
Dr. Rufial, how surprising would it be if a vaccine that produced neutralizing antibodies did not lead to some protection against infection?
Yeah, I mean, we don't have a vaccine against coronavirus. So that's really kind of a new type of vaccine that we're trying to study. So we don't really know what actually protects against COVID. We know with other respiratory virus, that usually this type of particular antibody that you mentioned, the neutralizing antibodies, are really key for protection. I mean, again, it's just how long will they stay? What's the right level of protection? Remain to be determined.
Great. And what are you looking for in phase 3 that you were not looking for in other phases?
Yeah, no, that's a great question. Again, the study was first in humans, so really the goal of the study was to make sure that the vaccine is safe. In addition, we collected blood for safety, but also to understand better the immune response. With the phase 3 trial, the question will be, is the vaccine able to protect against acquisition of disease, able to protect against somebody who will acquire the disease but will not develop severe disease, compared to other volunteers that will receive just the control or the placebo.
And I think this is a similar question. What will you look at in phase 3, phase 3 study to improve the vaccine's effectiveness and to reduce the side effects?
I mean, based on the result of the New England Journal paper, the immune response was quite similar between the 100 micrograms versus the 250. However, some side effects were seen more with the 250 micrograms. So the way forward was to select the 100 microgram dose to be the one that will be tested in a phase 3 trial.
Do we have any sense as to whether the antibody response wanes?
So there are some publications out there on a patient who got infected with COVID that the antibody levels could decrease over time. Again, we don't know what the significance of that is. Will that make them at risk of reinfection? We don't know what other component of the immune system could also be protective in addition to the antibody, for example, like the T cell response. So just a lot remain to be understood about the disease and how somebody who gets exposed actually acquire the infection, and if they do acquire the infection, how severe it is.
With dengue, further exposure to the virus, including vaccination, leads to worse symptoms. Is there any chance that this could happen with COVID? Would that mean exposure after vaccination could worsen than exposure without vaccination?
Right, we don't know that yet, but that's a very important question. It's on the enhancement of disease that's created by certain level of antibody. Our sample size was small. Nobody acquired COVID in this study. It's really just to base it on a phase 1 trial will be hard, but the phase 3 trial will be looking at that in particular.
Are you optimistic about the findings as you go into the next phase?
Yes, I mean, absolutely. I mean, those are good results. Which candidates will be the one that will protect remains to be determined. I think it's why speed is very important and very emphasized in the media. I mean, I think having a vaccine candidate that work and is safe is really the most important part. So probably not necessarily being the first vaccine, but the best vaccine as far as the balance between the protection and the safety. And then perhaps we need multiple vaccine candidates. This is 7 billion of us, and if all of them will like to get the vaccine, we need to have enough manufacturing of doses. So it could be that it's an effort across multiple manufacturers to get this pandemic over.
Okay, and what was the most surprising finding in the research?
I mean, I think we were pleasantly surprised that the vaccine was well tolerated. I think we were also pleasantly surprised that it did induce an immunity similar to convalescent people that recovered from the disease. So that's an important point to emphasize.
And then you said it was important for members of the community to volunteer for the trials. And if someone's interested in signing up, how they can do that. I've gone ahead and put in a website that people who are interested in volunteering for vaccine trials can go to. Is there anything in addition to that?
Yeah, no, that's absolutely right. We're really encouraging people to sign up with the Coronavirus Prevention Network.org link. it's really important to make sure that all of us as a community sign up. It's also very important to see how the vaccine will work in the most vulnerable population. That's mostly the elderly or people at risk of complication from COVID. So thank you for doing that.
Yes. Is there more than one shot that is administered per person? Which side's dosage provided best results?
Correct. So it's hard to say if one dose is enough versus 2 doses, but we already know that 2 doses actually improve the immune response. So the phase 3 is moving forward with a 2-dose regimen separated by 4 weeks.
Do you know how many people have already asked to be part of the vaccine trial? Did you receive a flood of requests?
We did. I mean, through the phase 1 trial, we had received thousands of calls. Obviously, the size of the phase 1 trial will not be able to accommodate so many requests. And we hope that the continued list will remain with the phase 3 trial.
And is there any indication that test subjects were contagious after the initial injection?
So the vaccine itself does not contain a live virus. It just contained the genetic material that will produce the spike protein, which is the important part of the virus that our immune system recognizes.
What if the volunteers in phase 3 are very cautious and not many get infected with the virus?
I mean, that's definitely the risk of the phase 3 trial. So, for example, advanced stage of testing had been done for Zika vaccine in Latin America, but it happened at a time where the pandemic died. So it was really hard to see if the vaccine is actually protective or not. That's definitely something that the phase 3 trial are looking carefully at to see how the pandemic will evolve.
Okay, great. It looks like that's all of our questions. In the chat function, hopefully everyone who wanted it picked it up. We put the link to our release, and then also that link to for people who are interested in volunteering. If you didn't happen to get it, and just shoot us an email, and we will get you those links. We will be sending out this recording within 10 minutes of the conclusion. And if you have any other further questions, please reach out to Catherine Morrow for follow-up, and we will get your questions answered as we can. Dr. Rupial, thank you very much for your time, and thank you everyone for joining us today. This concludes our briefing.
In April, our results yielded in COVID-19 the reason why we had to remain home. I'm grateful for our county executive who has created a transition plan that has allowed us to reduce our COVID-19 positivity rate and to reduce our weekly number of COVID-19 cases. But what still remains certain is that Prince George's County Public Schools and our county is the epicenter for COVID-19. In conversations, emails with our staff, students, parents, and community members, once Maryland State Department of Education released their guidelines, they shared with me 2 scenarios that began to emerge of what areas they wanted to see us open in the fall. Those 2 areas were distance learning, a continuation of what we offered in the spring, or a hybrid model. That hybrid model would be 2 days a week in person for our students and 3 days online, creating a staggered schedule that would allow us to have half of our student population in school during the opening. In June, we administered a survey to our families, teachers, and administrators, asking them about those models that the Maryland State Department of Education released. Our results underscored those conversations that we had. Our community, our teachers, and our administrators favorably wanted a continued distance learning model. In evaluating instructional models for the opening of school, we were guided by 3 main principles. They were safety, equity, and excellence. Safety for our staff and students remain paramount in our decision making, making sure that all students have the tools needed to be successful in the educational experience, and always maintaining an opportunity for us to provide excellent, high-quality teaching and learning opportunities for our students. I spent several months talking, listening to our extensive recovery team, which comprised of 100 staff members, community leaders, parents, and also looked at both models. As we evaluated a hybrid in-person model, significant concerns among our task force revolved around safety and logistics. And for us, we wanted to make sure that by August 31st, we would be able to smoothly implement a hybrid model. Because of the feedback that we received from our task force and community survey, for the 2020-2021 school year, Prince George's County Public Schools will begin our school year on August 31st with a distance learning model. We will offer distance learning from August 31st until January 29th. Our students will experience a full school day of a robust delivery of instruction 5 days a week. Our teachers will have the option to deliver that robust delivery of instruction from their classroom, where they have access to a variety of materials. We will offer small group instruction for special groups, such as our English language learners and our special needs students. And on day one, we will become a one-to-one school district, ensuring that every student has a laptop or an iPad and has Wi-Fi access in order to begin the first day of this robust learning experience. In addition to our distance learning model, we will provide additional student supports. Instructional supports will be offered for all of our students in individual and small groups to help build and strengthen their content in our core content areas, such as English, language arts, mathematics, science, social studies. And what we have learned from the spring is that during this fall, it's important for us to provide social and emotional supports. So our elementary students will have components built into their class schedule that allows us to address this area. And our secondary students will have strategies immersed throughout their content areas. We've also learned that we need to support our families more. And so we will have parent support centers strategically located throughout Prince George's County that will allow our parents to get hands-on experience and access to technology strategies in order to navigate our new instructional delivery model. And school meals will continue to be offered from all 206 schools 2 days a week, similar to the model that we followed this spring. While offering those 2-day-a-week meals offerings, we still will make sure that our students are fed all 5 days. As stated earlier, we will ensure that all of our students who have not received a Chromebook or iPad will receive a technology device prior to the opening of school, and we will reassess families in the need of Wi-Fi access to ensure that everyone is connected on day one. If you're a new family and are deciding to join the Prince George's County Public School family, you will be included in that model, and we will ensure that you too get a technology device. I hear daily the question as it relates to interscholastic athletics, and at this time, we will not be able to implement interscholastic activities that will allow our students to remain safe. We will continue to keep you updated around the state as decisions are made around athletic sports, but we will be offering opportunities for students in their clubs and organizations to still continue virtually. There are some key dates that I want you to jot down and to remember. As stated earlier, Our opening of school will be August 31st, and we will continue distance learning until January 29th. That is quarters 1 and 2 of our school system. The next date to remember is December 1. On December 1, we will reassess where we are as a county and make a decision whether it is safe for us to begin a different model on February 1. Parents will have an opportunity from December 1 through December 18th to make a choice whether they would like to continue with distance learning or if they would like to transition to the hybrid model, which is 2 days a week of instruction in person and 3 days of distance learning. That process will be from December 1 through December 18th as stated, but it would not begin until February 1 and will continue until the last day of school. Of course, we will keep our parents and community informed through this process and will release to you on December 1 the status of our county and country as it relates to COVID-19. Next steps. We'll continue to review and adjust our instructional plan as needed based on input that we receive from many of our community members and staff members through our telephone town hall, through continuous outlets such as email and phone conversations in order to ensure that we have a robust delivery of instruction for our students on August 31st. We will release our comprehensive draft report next week with extensive details on a student's experience, teaching experience, and ways that we can support our parents through this difficult time. And we will continue to commit to providing timely communication with families through the reopening of Prince George's County Public Schools designated webpage, email, social media, and our robocall system. I fully understand that the decision that has been made to continue with distance learning from August 31st until January 29th is one that is not the perfect scenario. We all want to have our children and our staff back in buildings the way that we used to. Unfortunately, we're not at a time where I feel comfortable that we could move forward with excellent delivery of instruction and keeping our children safe in physically being in our buildings. I guarantee you that we will deliver an amazing, robust distance learning experience that we will be known for across the state of Maryland. Please join me in telephone town halls that will take place tonight for our family and community members from 5:30 to 7 p.m. and our employee town hall, which will take place tomorrow from 5:30 to 7 p.m. You can find additional information on our PGCPS webpage. For updated information, this PowerPoint presentation for today, and then our comprehensive guide that will be released next week, please visit our website. Thank you for your trust in Prince George's County Public Schools and continue to remain safe.
Would be restricted to certain areas to minimize exposure to other residents. Facilities must also have their own written guidelines in place before any visitation can occur. We know that this has been a trying time for the families of residents in these settings. However, as we've mentioned before, when it comes to some of our state's most vulnerable residents, we have had to take extra precautions to save lives. But with these guidelines in place and with the proper safety protocols in place within these facilities, I am grateful that families will be able to once again be together. God bless them all. Next, as it was reported yesterday, the list of states from which travelers to New Jersey are being advised to observe a 14-day self-quarantine period has been updated. Minnesota, New Mexico, Ohio, and Wisconsin have all been added. And as Delaware has seen a sustained improvement in its public health metrics, it has been removed from the list. We continue to ask everyone who has been in one of these 22 impacted states to practice self-responsibility and good citizenship and comply with our travel advisories. This goes equally whether you are a visitor to our state or a New Jersey resident returning from one of these states. If you've got any question, visit covid19.nj.gov/travel for the complete list of states and to learn whether you should be self-quarantining. And we further urge you to get a coronavirus test to ensure your health and safety and that of those around you. We have the capacity to provide tests, more than 240 locations statewide, and again, a link to a searchable list of sites is also available at covid19.nj.gov/travel. Our 14-day self-quarantine advisory for those who have come through a known coronavirus hotspot is there for a reason. We have done tremendous work to make New Jersey a leader in the nationwide effort to mitigate this pandemic, and we cannot have this work undone by anyone who was in a known hotspot and may have unknowingly brought the virus back to New Jersey with them. Our work to bring this pandemic under control here in New Jersey continues, and we simply cannot risk more cases coming in from elsewhere. Today, we are announcing 396 new positive test results, and since March 4th, we've reported a total of 176,278 positive results for coronavirus. The daily positivity rate for tests recorded on July 10 was 2.13%. This keeps us among the lowest positivity rates in the entire country, although, Judy, it's up a hair since yesterday, but it's still among the best in the nation. It speaks to our ability, all of us, to meet our needs for testing on a daily basis, and also the great personal responsibility that millions of you have taken. Our rate of transmission currently stands at 0.93, meaning that the rate of spread is below 1, and that means it's slowing. Again, a little bit up from the past couple of days. But the only way we can keep both our positivity and our rate of transmission in the green, so to speak, is by taking the precautions that we have across the past 4 months. That means, again, social distancing, wearing a face mask whenever you're out in public, washing your hands frequently with soap and water for at least 20 seconds, and staying at home if you exhibit any symptoms of respiratory illness. In our hospitals yesterday, there were 923 patients being treated for COVID-19. Again, that is up slightly from yesterday. The number of patients requiring intensive care was 151, about flat, and there were 78 ventilators in use. That's down a hair. As we have noted, the numbers in our hospitals continue to trend in the right direction, and this is by all measures a good sign. But as Judy has noted many times before, the increasing rate of spread of this disease among younger residents, those who may be asymptomatic or whose illness may not proceed to where they need to be hospitalized, that fact remains troubling. This is why we still need to be vigilant. Don't be a virus spreader to family members or others who may be more vulnerable to COVID-19. Look at how we rank here nationally. We still rank way too high in terms of those in the hospital and those dying from this virus. When you wear a mask, you help protect those who are vulnerable from you. Be selfless. Help us push our numbers lower. Wear a mask. And here's why. Today, we have the solemn responsibility to report that another 27 deaths have been confirmed from complications of COVID-19, and that the total toll in our state is now 13,660 confirmed losses of life. The number of probable losses due to COVID-19 has been increased slightly to 1,974. And Judy will give more color, as we have begun to over the past week or so, on the deaths that we report in a given day, what the build-up to that looks like. Again, we are proud of the accuracy, and we, if anything else, are going to err on the side of being conservative on reporting these numbers. But Judy will give you some more color. As we do every time we come together, let's remember a few more of those souls we have lost. We'll begin today in Dover, in Morris County, to remember Orphelia on the left. She came to this country from her native Colombia, and was a proud Dover resident known by many throughout the community. She was an avid volunteer for local organizations and took pride in lending her creative talents to projects for groups ranging from Casa Puerto Rico to the Dover Rotary Club. But her greatest joys came at home, spending time with her husband of 37 years right there in front of you with her, Francisco, with whom I had the great honor of speaking yesterday, doing whatever she could to support her sons, David and Jason. And I had the great honor of speaking with Jason as well yesterday, by the way, who works with great distinction at the U.S. Attorney's Office. As they all pursued their dreams, the boys at Seton Hall University, and built their careers. And by the way, she was also loving tending to her beloved garden. As her husband Francisco said, and I quote him, "She did the impossible so her kids could have a better future than she." Francisco, by the way, fought his own battle with COVID-19, and thankfully he is still with us and says he is doing much better. He's here to carry on Orphelia's spirit. And Jason and David are with him too, and together they're going to keep tending that garden in tribute to the woman who tended to their family. May God bless you, Orphelia, and may he strengthen Francisco, Jason, and David. Next, we remember, there is a boatsman, if ever there was one, right there. We remember George J. First, Jr., a longtime resident of both Aberdeen and Waretown. This upcoming Friday, Judy, was to have been George's 100th birthday. He was known, not surprisingly, Pat, by this picture, as the captain by many for his lifelong love of sailing, and as pop to his grandchildren and great-grandchildren. A Jersey City native, George was a U.S. Army medic with the 113th Field Artillery Battalion during World War II and was awarded the Bronze Star. Upon returning home, George married the love of his life, his wife Margaret, and they would raise a family and be an inseparable couple for the next 34 years before her untimely passing in 1980, only at the age of 60. Professionally, George started in business when he took over his family's insurance business, and he earned a degree in business administration from Rutgers University in Newark at night while working full-time. He would eventually go on to work for the U.S. Postal Service, the Federal General Services Administration, and the Department of Housing and Urban Development before retiring in 1985. Retirement, by the way, didn't slow George down, and he could often be found at the helm of his 33-foot Pearson sailboat until, by the way, the age of 95. George leaves behind his three children, George F., Lynn, Madeline, known as Lynn, and Catherine, known as Kathy, and I had the great honor of speaking with Kathy yesterday, and their families, including 3 granddaughters and 5 great-grandchildren. He's also survived by his sister, Jane. A member of our greatest generation, and we're going to speak about several of them today. We thank George for his service to our nation, and we hope he has found a sea in which to keep sailing. God bless you, man. Finally today, we remember another of our World War II veterans, Carlton P. Penn Frost IV. Turned 99 years old just a few weeks before he passed due to COVID-19. Carlton was born in New Hampshire, but he grew up in Ridgewood and graduated from Montclair Academy before returning to New Hampshire to attend Dartmouth College, and graduated, by the way, in 3 years. He entered World War II as a second lieutenant in the United States Marine Corps, but his service was cut short when he was wounded by friendly fire during a bombing run, and he returned stateside to recuperate. With the war over, Carlton went back to Dartmouth to study at the Amos Tuck School of Business, and then joined his uncle, the architect Jens Larsen, as a draftsman. And for those who have visited the campus of Bucknell University, Carlton was the person who designed the Bertrand Library cupola. After Carlton and his wife Ruth were married in 1947, they chose Bergen County's Hohokus as their home, and he changed careers to enter sales for Becton Dickinson. He coached youth football and baseball teams and helped leading packs of Cub Scouts and Boy Scouts. He leaves behind his daughter Lee, with whom I had the great honor of speaking, and his son Carlton, and their spouses, along with his 3 grandchildren, Sarah, David, and CP, 1 great-grandson, and a great-granddaughter who is to be born next month. Lee wanted me to make a point which I think is an important one. She works in the mental health field, and she said telehealth and the embracing of telehealth and what we've done to make that more accessible, available to folks has been a game changer. So Lee, thank you for you and everyone else who works in the field of mental health. What stories his almost to be born great-granddaughter will be told of a life well lived. We thank Carlton for his service to our nation, his community, and God bless and watch over him. 3 more tremendous members of our New Jersey family lost to COVID-19. We say this so often, I think we say it probably every day, Judy, but Orphelia, George, and Carlton are the reasons why we cannot be complacent. They are the reasons why we need to remain vigilant, to wear a mask, and to get tested. Imagine them as your family. Imagine being the one who spreads coronavirus to someone you love, who is more vulnerable to COVID-19 than you are. Imagine that. This is why we need to be smart and selfless. This is why you need to mask up when you leave the house. This is why we cannot yet open every indoor business. We know this virus is deadlier in close quarters and where crowds who aren't taking precautions seriously can more easily spread it. This is, in fact, who COVID-19 wants to latch onto for a free ride. Don't give it that chance. Wear a mask, folks. Be smart. Do it for yourself. Do it for your family, your friends, your neighbor, your community, for all of us. Shifting gears, I have to say last night yesterday kicked off, Pat, the Last Dance World Series of over 200 high school baseball teams, actually in a club mode, but in an extraordinary tournament that will culminate right here in Trenton on July 31st at 7 p.m. for the championship game. My son Sam and I went to a few innings of Red Bank Catholic against Long Branch. The spirit was incredible. The baseball was really impressive, and that happened up and down our state. I want to give a shout out to my dear friend Paul Sarlo, Senate Budget Chair, but also one of the driving passions behind this and the manager of his own Wood Ridge baseball team. Next, I want to highlight another one of the small businesses who are making it through this crisis because of the lifelines that we've been proud to offer. Princeton's Monday Morning Flower and Balloon Company was established in 1988 by Georgianne and Kevin Vinicombe, taking their name from their initial service offering, providing fresh flower deliveries to corporate offices every Monday morning. But soon, increasing demand made Monday Morning Flowers a 7-day-a-week business. And today they have 8 employees who help create and deliver floral arrangements, gift baskets, and balloon bouquets to customers in more than 70 zip codes, Judy, across Central Jersey, and I suspect that includes yours. Monday Morning Flowers remained open throughout the pandemic, fulfilling online orders and doing curbside pickup when feasible, but their ability to remain open was always a concern. The Federal Paycheck Protection Program, or the PPP, offered some assistance, but Georgianne and Kevin were still left with many expenses that the PPP funds could not cover. Thankfully, they learned of their eligibility for 2 grants from New Jersey's Economic Development Authority, and they were able to meet overhead, pay their insurance, and cover additional expenses. Monday Morning Flowers doors are open today, and they remain busy fulfilling customer orders. For a business that delivers happiness, we need them a little bit more today than ever before. So to you, Georgianne and Kevin and your entire team, thank you for remaining optimistic about our future, and thank you for continuing to be a leader in Princeton's small business community. Now, before I close, I want to talk about 3 other members of the greatest generation, one of whom is still with us, and 2 of whom have passed. To the best of my knowledge, neither from COVID, by the way. First one, I just learned this morning that the father-in-law of Assemblywoman and friend Pam Lampett passed. Gordon C. Lampett. She and I have been going back and forth talking about her father-in-law and the inability for so long for folks to visit where we had no choice. And Judy, just before Father's Day for the long-term care facilities, you were able to offer that outdoor opportunity. Her father-in-law, Gordon Lampett, was a veteran of not one, not two, but three different American wars: World War II, the Korean War, and Vietnam. And there are not many folks who can say that. And she lost her mother-in-law, by the way, a few months ago. So Pam, to you and your husband and your family, God bless your father-in-law. We get another story, and this one I want to pull up, just happened yesterday. So yesterday was Bastille Day. It was also Sheila Oliver's birthday. Happy belated birthday, Sheila Oliver. Pastor Ronald Slaughter, by the way, also his 45th in Newark. And we're also joined today by Jared Maples, Director of the Office of Homeland Security and Preparedness, who had a birthday last week, but not yesterday. But yesterday's Bastille Day. So I reached out to both the French ambassador as well as their consul general in New York, and lo and behold, their consul general, Anne-Claire Legendre, who will be leaving her post in August, both raised flags, the French and American flags, with Jersey City Mayor Steve Fulop, and then took a very special mission down to Ocean City, where she, again yesterday on the basis of Bastille Day, named Francis McCormick a Chevalier Knight of France's Legion of Honor for his exceptional deeds for the French Republic. And there is Francis being pinned by Anne-Claire, a member of the French military there on the left. Francis enlisted in the U.S. Army, Pat, at the ripe age of 22. We take our hat off to him and thank him, as we do Gordon Lampett, for their service to our nation. And Francis, if you or your family are watching, I hope we get a chance to give a socially distant but apropos greeting sometime this summer on the boardwalk in Ocean City. And as I close, I have to sadly acknowledge the passing of another hero, a true American hero, Vincent Hines of Madison. He passed away from natural causes on July 2nd at the age of 95. And he was one of the 156,000 troops who landed on the shores of Normandy on D-Day. A Navy medic, his primary job was to rescue wounded soldiers and bring them back to a ship from the shorelines. By the way, Vincent was 19 at the time. I spoke to his son Brian about his dad yesterday, and we had a great conversation. His heroism and bravery led to his membership in the French Legion of Honor, the highest honor from a grateful France for the efforts on D-Day, which led to its liberation. Last year, Vincent was awarded the Mayor's Hero Award from my dear friend Madison Mayor Bob Connolly. And on Monday, Bob led the Borough Council in a moment of silence in Vincent's memory. Another loss of a generation which gave this world hope and gave us its all. So may God bless Francis, who remains with us, Ocean City's own, and Gordon and Vincent, who have passed, and all of our veterans living and gone before us, and we thank them for their great service to the United States of America. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. Well, as the Governor mentioned, the Department will be releasing a directive that will allow the parents or legal guardians of pediatric, developmentally disabled, and intellectually disabled residents of our long-term care facilities to arrange for, by appointment, indoor visits with their loved ones. Any resident in a congregate setting, as you know, is at very high risk for COVID-19, and great vigilance must be taken to protect these vulnerable individuals. Yes, we do understand how stressful and heartbreaking it has been for so many families not to be able to visit their loved ones in person for more than 3 months now. Reuniting families, particularly in pediatric long-term care facilities, is a critical step for the mental, physical, social, and emotional well-being of these children, but we need to be vigilant. Given how medically fragile the pediatric population that resides in long-term care facilities are, we have been focused on putting together guidance that not only safeguards the health of these individuals, but includes the very latest that we are learning day by day about this virus. Facilities can only allow these visits if there has been no new probable or confirmed coronavirus cases recorded across a 28-day period, which is 2 incubation periods of COVID-19. Visitors, of course, must be screened for symptoms, which includes temperature checks and potential exposure to COVID-19. A designated area should be established for visitors to be screened that maintains social distancing and infection control standards. If an individual has any COVID-19 symptoms or any possible exposure, they will not be permitted to visit the resident. When staff are transporting the resident to a designated visitation area, a safe distance of 6 feet must be maintained between other residents and staff. Facilities must designate a specific area for visitation in order to limit the visitor's movement around the facility. All visitors will be required to wear a mask, be educated on proper hand hygiene, and practice social distancing with anyone other than their loved one. Facilities are required to obtain informed consent from the resident and the visitor in writing. Those giving consent must acknowledge that they are aware of the potential dangers of COVID-19 exposure and will comply with the facility's policies during the visit. As part of the consent form, the visitor must agree to notify the facility if they tested positive for the virus or have symptoms within 14 days of visiting. Each long-term care facility will set the hours, days, and durations of the visits, and at this time, only parents or guardians are permitted to visit. At least 48 hours before indoor visitation begins, facilities must submit an attestation that they have implemented the requirements of the department's directive. That is, designated areas have been set aside for visitation, ensured that sufficient staff and personal protective equipment are available, and create a system for scheduled appointments. So I encourage facilities to move quickly with their attestations so they can begin these long-awaited visits. Moving on to my daily report, as the governor shared, our hospitals reported 923 hospitalizations of COVID-19 positive patients and persons under investigation. There are 151 people in critical care, with 51% of those on ventilators. Fortunately, there are no new reports of multisystem inflammatory syndrome in children. The governor reviewed the new cases and deaths reported today. In terms of deaths, the breakdown by race and ethnicity is as follows: white 54.2, black 18.3, Hispanic 20.2, Asian 5.5, other 1.8. Of the deaths reported today, 17 occurred in the month of July. 10 of the deaths reported occurred between the dates of April 16th and June 3rd. Hospitals reported 8 mortalities yesterday. At the state's veterans' homes, the numbers remain the same, and at the psych hospitals, we are reporting 1 additional patient testing positive for COVID-19. The daily percent positivity as of July 11th in the state is 2.13%. The northern part of the state reports 1.98%, central 2.01%, and the southern part of the state 2.68%. That concludes my report. Stay connected, stay safe, stay healthy, get tested, and mask up. Thank you.
Judy, thank you, first of all. Not necessarily every day these days, but most days you and I are in touch with, in fact, you are every day, and I'm most days in touch with our hospital systems. And they're in a world of a far better world than they were in, obviously, right? I mean, the numbers are a fraction of what they were. But it has to be said that we are still, plus or minus 300 to 400 new cases a day. And hospitalizations are under 1,000, but they're still staying plus or minus 900. And so, any observation on that?
Yeah, I think that to talk about the hospitalizations, we spoke yesterday about the turnaround time in testing. And the longer the turnaround time in testing, patients that are coming into the hospital, perhaps with a heart attack or appendicitis, are identified as persons under investigation, because everyone will get tested. So if we look at the persons under investigation versus those that actually end up to be a confirmed COVID-19, it's about a 20 to 30% conversion rate.
Yep.
So we may start reporting the discharges of COVID positive, and that will show you the difference. But I want to make it clear that everyone coming into a hospital now is considered a person under investigation until proven otherwise.
And the proof is going to be through a test.
A test, confirmed test.
Positive or negative. Thank you for that. I want to give a shout out. He's not watching, by the way, but my fellow governor, Oklahoma Governor Kevin Stitt, just reported, came out an hour or so ago, I think, Mahan, that he has tested positive for coronavirus. He's a good guy. He's got a great family, so he is in our prayers. I think he's the first American governor to have tested positive. So keep Kevin in your prayers. Pat, we missed you. We've kept you and Linda in our prayers, and we'll continue to do so. One of the back and forths that you and I and Judy have had is that on the COVID side, too much indoor graduation or other party activities that have led to flare-ups. We talked about Westfield, Red Bank, Regional canceled their graduation. Another community canceled their participation in the last dance. I think it might have been Manasquan, but so that's on the COVID side. But you and I have also talked about we're not immune to what we're seeing around the country in terms of this lethal cocktail of being pent up, hot weather, trying to undo the stain of racism, folks trying to come to grips with community and police relations. There's a lot of non-COVID violence everywhere, and it seems like everywhere in the country, and we're not immune to that. So any thoughts you have on that front?
That's right. Thank you, Governor. Yes, it's troubling to report. I met with the ROC commander this morning with regard to shootings in New Jersey. We had 39 victims of shootings in this one past week alone, with 13 of those succumbing to their injuries and passing away. Since the year to date, we're up 19% in shooting murder victims compared to last year. So at this point, last year was 84. Sitting here today, we're at 100 shooting murder victims. And we continue. We have phenomenal relationships with our federal, state, county, and local partners. And we're certainly concerned about it, Governor, because we're seeing way too many shootings, and the likelihood of it continuing through the warm summer months gives us a tremendous amount of concern.
I mean, as we said, the cocktail could not be more challenging. You've got gobs of people out of work. You've got small businesses that have been crushed. Judy, you've got the mental health challenges gone with the physical pandemic reality. You've got hot weather. You've got George Floyd's killing and all that has gone with that. That's almost an unprecedented combination of factors.
That's right.
Other than those knucklehead indoor parties that young folks are having, anything on the compliance front of note on
There
COVID?
wasn't. I was glad to note that there wasn't any EO violations reported last night, which was good news. But again, we're focusing on both EO compliance as well as violent crime and that troubling trend that we're seeing across the entire state.
General public safety. And by the way, it's fair to say we're not unique right now. If you look across the Hudson in New York or into Philly, I mean, you see it all over the country, Chicago these days. So, folks, we're going to get through this together. Not unscathed, we know that, but we will get through this together. I've lost Dante. Dante, we're going to start over here. Mahan, we will be with folks virtually tomorrow, but we're likely, the only wrinkle to that is we're likely to have a press event on something unrelated, somewhat related, but not directly related to COVID tomorrow afternoon. We'll communicate the COVID facts with you virtually still, but I will have the opportunity to address a couple of items that are related to this in the context of that press event, which again is largely unrelated to the specific reality of COVID-19, although it is related. And then we'll be back together Friday physically here at 1 p.m. And again, we are still going to be on the Monday, Wednesday, Friday, unless there's a reason to go otherwise. in which case we will come to you and let you know. Good afternoon.
Good afternoon, Governor. I have a question about the travel advisory. This week, New York State began enforcement asking travelers to fill out forms when they're coming into New York airports and leveraging $2,000 fines for anyone who does not comply. Will you consider enforcement for the travel advisory at any point? And is anything like that in terms of a form being done at Newark Airport?
Anything else, or is that? The answer is we're considering a number of items. Judy mentioned development of a potential technology tool. We certainly are going to be aggressively public relations heavy. We're not there on fines. We want to appeal to people's personal responsibility to do the right thing. We are happily building up our contact tracing community core, so we have a lot more capacity there than we even did, a month ago. And again, this is an advisory that New York, Connecticut, and we put out deliberately. I've said this before, that we put out before we had all of the underpinning elements of it in place deliberately. We don't normally do that. We normally get all of our T's crossed and I's dotted, and then we make an announcement. In this case, we wanted to use the bully pulpit, and we've used it every day in that respect. We are the United States of America. I say this with a heavy heart. I would love to be able to stop people and turn them around at our borders, whether that's Newark Liberty or literally at our borders. We can't. That's not the way the United States works. But we want to appeal, and we want folks to know that we mean business. And as I said, from the moment one, Judy reserves the authority to target, not as a general population matter, but if Pat flaunts this deliberately, which he won't, and comes back in from a hotspot, Judy has the power to go directly at him and sanction him. But we are not, a common theme to our principles among New Jersey, New York, and Connecticut, but executed, as we have, by the way, in a lot of other steps specific to our own Constitution, our own realities within our states, and that's the way it will be. Thank you. Do you have anything? No, you're good? Hello, sir.
Good afternoon, Governor. Executive Order 163, which calls for those who cannot social distance outdoors to wear masks, how should that be enforced at the local level? One police leader told us that the Attorney General has said no to warnings and no to issuing summonses. One police leader called the lack of enforcement ridiculous and absurd and said, quote, "You can quote me on that." Since lawmakers are being asked to approve this tomorrow, can you be specific today about the ways you will spend $2.7 billion in bond proceeds before September 30th? Is the priority to undo $2 billion in fiscal year 2020 diversions, reverse programs cuts for things like the funding for property tax relief for seniors and the disabled, or is it for something else? Also, how specifically would you spend another $7.2 billion in bond proceeds in fiscal year 2021? We heard from a viewer who was just able to file for unemployment benefits after trying weekly since March, but the system is only enabling her to claim from the date she filed, not the months prior. A Department of Labor spokesperson confirms that this is the policy, and could you clarify, are residents now ineligible for their benefits during the time Department of Labor was unable to process? Finally, will the administration consider reopening in-person unemployment centers? Thank you.
We haven't, I'll start on the back. I have not, I'll speak for myself, been a part of any discussion on opening in the in-person unemployment centers. Does not mean that we won't at some point, but we have no news on that front. I hate to be a broken record, but if we could get the specifics of the information. Did you say it was a woman who just got the unemployment benefit? Can we get her specifics to Mahan afterward? It literally has come down. Now this is for months, I think probably the past 3 months. These are overwhelmingly, if not entirely, specific to the individual. And again, tomorrow is Thursday, so we'll be hearing again what the unemployment numbers are going to look like. As it relates to how we spend, it is latitude to borrow up to 2.7 plus 7.2 for a total of 9.9. That's the latitude that we're asking for and getting. I'm happy to say from the legislature. How How that will be spent is, bear with us, we're working on the budget. We've had preliminary broad stroke meetings with the leadership in the legislature. We've had our team working feverishly. I need to deliver a budget by August 25th, Matt, I believe at latest. So it's too early to tell, but you should assume that we'll be putting money, whether it's in the budget until September 30th or the budget that goes till next June 30th. I think you should assume that we'll be putting money in the priorities and the obligations that we speak about all the time, being there for education, healthcare, keep our frontline workforce employed, meet our obligations on pension and other fronts, but the details, bear with us on that. I'm not aware that of the comment about the Attorney General saying don't warn and don't summons. Here is I'll give you two ends of the spectrum on being outside. And Judy, if you or Tina see this differently, jump in. You're walking down the street and you're walking your dog, or you're with your husband or wife, or you're out for a run and you're on a trail in the woods near your house, and you're socially distancing. We don't really have any interest in that. So that's at one end of the spectrum. As long as you're able to socially distance, bless you. I still think you'll see us with our face coverings on, but that's not a priority. What is a priority, and we have asked explicitly, not just the state police, but the park police and local authorities and county sheriffs, we expect folks to be warned and action to be taken if there is intense congregation where folks are not socially distancing, and it's for a meaningful amount of time. You're lined up to get a slice of pizza, you're on top of each other, and you're not wearing your face covering. That's not a good look. That's not smart. That's not a good thing for public health. So that's the sort of other end of the spectrum. I mentioned I went to one of the Last Dance games last night. I'd say mixed in terms of compliance on face coverings. But in fairness, for the most part, I can't say this completely, the bulk of the folks who weren't wearing face coverings were also not on top of each other. So more compliance, Judy, but not where it needs to be. I don't want people to think it's on an absolute scale where it needs to be. We need to see a lot more of these in New Jersey if we don't want to start looking like Florida and Arizona and Texas right now. But it is clearly better, and it's clearly more compliance when you're seeing folks on top of each other, not where it needs to be. And that has to be, it's hard to enforce, I admit that, but it has to be enforced. And we need, by the way, whether it's members of law enforcement, elected officials, faith leaders, community leaders, they need to lead by example and wear face coverings themselves, not just for their own safety, but to make a statement for the rest of us. Thank you. Do you have anything, sir? You good? Good afternoon.
Good afternoon. Thank you, Governor. Just a quick clarification first from Colonel Callahan. The 19% increase in shootings, is that all shootings or just fatal shootings?
The shootings overall are up 3% year to date, which the difference from 23 to 39, 538 to 553 year to date, but the shooting murder victims are up 19%.
All right, thank you. And I just have a couple questions on the travel advisory. Commissioner Persicelli, could you talk to us a little bit more? The governor mentioned some sort of technology tool that might be used. Can you explain that a little bit more? And would that involve tracking people with or without using their cell phones? And for both yourself and the governor, I'd like to find out how a state gets removed from the travel advisory list. How did Delaware get removed? And I believe it was last month you mentioned that Washington State was on the very first travel advisory list. Officials from Washington State reached out to you. Were they complaining? Did they give you new information? Why was Washington State removed? And is it as simple as a state can get removed from the travel advisory list if they complain to you?
May I start with that? And then
Yes, yeah, I just...
Believe me, they do complain, but that doesn't work. and no cash exchanges hands here is related to this. All kidding aside, the benchmarks are quite clear, and it's a rolling 7-day average. It's that simple math. It is, Judy, help me if I get this wrong, more than 10 new cases per 100,000 residents, or more than 10% spot positivity rate. So we're reporting today 2.13. If that were above 10, and it was consistently on a rolling 7-day average. I believe Washington did highlight that the data was not accurate for them. It was opposed to they went below it. They claimed that they were already below it, and I think New York, Connecticut, New Jersey were satisfied that they were right. And Delaware, not surprisingly, weren't happy to be on it. We didn't do anything about that, but their numbers came down. And frankly, the fact of the matter is, again, I hope we're not in this place again. Please God that we don't get to more than 10 per 100,000 or more than a 10% spot positivity rate. But if we did, please God we don't, frankly, I think that allows the equivalents of us in those states, or if it were our state, to say, folks, look at what happened to us. We can't let this happen. It seems to me you use that. And Delaware happily, and they had a flare-up particularly in and around Rehoboth Beach and the shore. They happily are below that, and we'll continue to watch it. Again, it's a rolling 7-day average. Anything you want to add to that or the technology piece, Judy?
The app's just about complete. It will be on your phone and a short questionnaire, and you'll be able to transmit it directly to the county and local health departments for follow-up. The questionnaire is short. It's where you're coming from, where you've traveled, and how can we contact you. So we hope to roll that out, if not by the end of this week, beginning of next week.
This is, as you can imagine, these are not rolling off a log things. So,
if I can follow up,
real quick,
how does a person get this app on his or her phone? Is it mandatory? Are they told about it when they arrive at an airport in the state? How does that piece of it work?
We're working with all of the airlines. So before people disembark, they'll be reminded to put it on their phone. As the governor shared, we're really focusing on personal accountability at this point in time. We'll see how it goes.
To be determined on the details. Thank you for that. Dustin, good afternoon.
Good afternoon. How quickly do you anticipate signing the bonding bill if you get it from the legislature on Thursday? What about the bill makes you think it will survive the impending legal challenge from Republicans? We've heard there's a possibility of youth sports being shut down again. Can you confirm or dispel
what
that
being
rumor?
shut?
Youth sports.
Okay.
Are hospitals in New Jersey reporting coronavirus data to the CDC that will now go to Health and Human Services? And do you have any concerns about that change planned by the Trump administration? And so far in the pandemic, you have approved a change to the open records law that effectively gives custodians license to delay requests for weeks or months. Legislature rushed through the stopgap budget bill, which you signed. The public has no say in the $10 billion bonding bill, and your office has declined to release records backing up costs for savings with the CWA and certain details about your task forces and recovery panels. Do you think the public deserves more transparency from state government, especially in a pandemic? And are you living up to your own values on transparency in government? Thanks.
On the first one, was that how quickly do we think we'll get bonding?
The legislature is expected to approve that bill tomorrow and send it to your desk. I'm just wondering how soon you may plan to sign it, assuming you will.
Yeah, I mean, I had another good conversation with the Senate President yesterday. I know they're trying to expedite this. This is something that you should assume, while I don't normally talk about these things, we've talked about this bill so much, I would say you should assume that it'll be signed pretty much as soon as it gets here. Unless Matt Placken disagrees, he's standing behind you, he'll agree with me. No comment on the legal challenge. I'm not a lawyer, number one, and number two, I wouldn't comment on it anyway, but I would just say two general statements. We wouldn't attach our name to something that if we thought it was not completely constitutional and legal. And secondly, this is not a comment about legality, but it's a comment on what's your plan B, folks out there? What else do you think we should be doing? I mean, it's just ridiculous, the absence of viable alternative public policy from folks who are whining about this. So I know nothing about pulling back on youth sports. Matt, agree? Judy, you agree? In fact, I was out there. I've been a spectator at, by the end of the week, 2 soccer matches and a baseball game, and I hope more. I need you to go back, Dante, because I don't understand the hospital CDC question.
The Trump administration is changing how the data is collected at the federal level, where the hospitals, most of them send the coronavirus data to the CDC. Now that's being brought under Health and Human Services, which is basically taking it out of career bureaucrats based in science and moving it into a political realm.
I mean, it's first, I'm not sure I was aware of that, but I would hope we'll continue to send our numbers as well to the CDC. In other words, if there's an extra burden of requests to send to the Health and Human Services, I assume, Judy, the hospital systems will comply, but they need to continue to send their data to the CDC. I will use this opportunity that the politicization of this is bad for public health. And so when folks start to, that doesn't mean people are infallible or that every system and every process is always right. But this attacking of Tony Fauci, who has dedicated his life to things like AIDS and Ebola, and now to coronavirus and COVID-19, and folks trying to politicize wearing a mask, when we know the science tells us that keeps more people alive. I wasn't aware, Dustin, of that shift. And by the way, I'm not trying to damn HHS, because we've got very good relations there, and they've been really helpful to us. I think of Admiral Giroir is there, and Alex Azar has been there, et cetera. But if there's a sense that there's some politicization of the data or more broadly of this pandemic, I think at the end of the day, all you get, other than division, which is the last thing we need in this country, all you get is more people who are dead. And that's the very last thing we need. Dustin, I think if you were to replay a tape of your last question, you could have put that into Soviet Union 1975. It sounds like we don't show anything. I mean, we take all that stuff seriously. If I wish we had had more luxury and more time on the clock on a budget. In fact, we've put forward an ethics package, which I would love to see put in place immediately, which is that every bill has to have at least, now was it 72 hours of public exposure? We do believe in transparency. We take every one of these requests for information seriously, one at a time. As you can imagine, we're overwhelmed with them. And so our style is to be transparent as much as we can be. But there is a reality here that the clock is very short in a lot of this stuff, that we've got a lot more demand for that sort of information than we have the ability and manpower to deliver it on a timely basis. But that doesn't mean we've changed our stripes in terms of our belief in transparency and good government and governance. And I want to once again give a shout out to an ethics package which we'd love to see get enacted. So thank you for that. Matt, how are you?
Doing well, thank you. Governor, how well stocked is the state on PPE for nursing homes and hospitals? Does the state have sufficient amount to dole out to these institutions in the event of an uptick in an outbreak? Regarding these mini outbreaks we're seeing in places you mentioned like Westfield, Manasquan, and at Red Bank Regional High School, are you rethinking allowing these outdoor graduations? And what have you learned from contact tracing related to those outbreaks? And on contact tracing, can you give us any concrete examples of success stories from tracing that has helped isolate and contain local outbreak? Privacy matters, notwithstanding. Yep. And just lastly, on Department of Labor, you said that, it's opening up the offices isn't something that you've discussed yet. I'm curious, given the backlog that we're still hearing about from people that haven't continued to not be able to speak to anybody in a couple of months. Is it something that you'll actively discuss? And just lastly, if not, if not in-person meetings for these folks, is there anything else that can be done right now to help the backlog?
All good. Pat, I said in your absence, and Judy was my witness, I can't remember if it was Tina or Ed, it might have been on different days and perhaps both of you, that you all are working on a plan for hospital systems for long-term care to require the operators, for counties, for essential places of work to have X days, 30, 60, 90 days of capacity. But that I said that as far as I knew, the PPE is coming in and we're sending it right back out again, that we're still not where we need to be. Is that a fair assessment?
That is still the case, and I just remind everybody that very first resource request we made of FEMA, which might have been in the first week of March, they still are delivering on that, and it's probably going to be months before they could fill that. But even about an hour ago, I got an email from a vendor who said they have 16 million surgical masks. We are in constant, whether it's the long-term care facilities or hospitals stockpiling on their own, combine that with the state stockpiling, we are on a daily basis seeking gloves. Nitrile gloves right now is a global shortage on gloves. So it is a daily conversation, and our logistics team in OEM stays on top of that daily.
The hope is, Judy, would you agree with that assessment in terms of where we are? The hope is that we can please God, and we're trying to, now that we've quieted down, although we're not out of the woods, the hope is that we're able to build the stockpiles back up, but we're not. I'd be lying to you if I said we were there yet, right? The mini outbreaks, Matt, I do not believe are associated with outdoor graduations. We have no data that I know of that are related to outdoor, beaches, parks. What I believe it is related are indoor house parties. And that is more anecdotal than science, but it is the indoor close congregation that's happening too much among young people. And Judy's been preaching this of late, and I would just add to her pleas. Tracking success stories, I think I know of at least a couple. The wedding parties who were in Myrtle Beach, Tina, the Hoboken reality, not last weekend, but the weekend before.
So we are really lucky that we have a very robust local health department system and a really great healthcare provider system here in New Jersey in general, because it's usually astute clinicians, the astute local health departments that recognize well before you even get the data, in contact tracing or whatever, that there's something kind of anomalous or something unusual that's going on in their jurisdiction. So, for example, as the governor pointed out, when we had identified a possible cluster associated with an out-of-state exposure, that was something that the local health department picked up right away because they've got this experience, they know how to recognize this, and it's the same thing with our clinicians that are out there. They see that there might be some sort of association with a particular locality or a common thread, and that's what brings to the attention, what ultimately happens with the public health investigation that subsequently follows.
On your last one, I just want to say, when I said I meant that literally, I've not been a part of that discussion. That's not to say that discussion isn't going on with Commissioner Acero Angelo. So I will make sure, Mahan, we follow up on the Department of Labor question, because clearly we're trying to, as much as we can here, to reopen things, including still with the challenges. We have the Motor Vehicles Commission, where in some of those functions, we literally can't avoid being open. But let's come back to you on that, because the notion of getting as many portals to get your unemployment claims heard and satisfied is, assuming we can protect public health, Judy, we're all in for that, right? Thank you. I'm going to mask up here with my mask from Judy Persicelli. Thank you for this. I want to thank Judy and Tina, as always. Pat, to you, and great to have you back again. And Linda remains in our prayers. Jared and Matt and Mahan. Again, we'll likely have another press event unrelated on the road tomorrow, and I will speak to, likely in addition to the reason why we're gathering tomorrow, anything new on unemployment and anything new on the COVID overnight numbers, Judy. And then otherwise, we'll be back here at 1 o'clock on Friday unless you hear otherwise. Again, folks, keep it up. Keep doing the extraordinary job you've been doing. Overwhelmingly, folks have, by the millions, have done the right thing. Let's keep at it. Keep the rest of the country where they're on fire in our prayers and hope that they have a speedy resolution. And in the meantime, we hope that we can keep ourselves as walled off as a state as possible. We keep ourselves walled off as much as possible, and the behavior is as compliant and good and responsible as it's been over the past number of months in the state. That combination is a winner, and that's what we need to keep after, folks. God bless you all, and thank you.
Dr. Mike Strigliano with Penn Medicine joining us out of Philadelphia. Good to see you, Dr. Mike.
Always a pleasure, Thomas.
Let's start with some encouraging news on the vaccination front. The first vaccine tested in the U.S. kind of revved up people's immune system.
Well, this is very encouraging news, and it couldn't come any sooner with all that's going on right now. Moderna's vaccine is showing great success in terms of safety and production of antibodies. In fact, in the patients that they are studying, they have found that the antibody response was similar to those folks who actually had the virus. So this is excellent, excellent news. It appears to be safe. Now what they're going to do is give it to a whole lot of people, and we'll see if it actually can mitigate, reduce the symptoms and risks of the natural infection of this virus, which is what we all need and are hoping for.
You know, this is a partnership with Moderna and the NIH. Side effects, fever, aches, those are normal and acceptable, right?
Well, Thomas, with any vaccine, there are always going to be some side effects, and some are more than others. You can get a low-grade fever, you can get local soreness, you can feel achy and feel fatigued. But I'll tell you what, Thomas, I'd much rather have those symptoms for 24 hours or so than end up on a ventilator in an intensive care unit. So this is the way to go. And we must say this, Thomas, that vaccinations will get us through this. And there has been debate for years by people who don't believe in vaccinations. This is not the time for that. And I'm taking a stand here, because if you look at one of the best ways in public health to prevent illness, it is through vaccination, whether it be measles, mumps, rubella, whether it be bordetella, pertussis, whether it be polio, whether it be anything. If you look through history and time, this prevents death and illness, and this is the way to go.
I mean, are you concerned, it's a good point, that too many Americans simply won't take the vaccine out of concerns about its safety?
Well, I'm very concerned about that. We had that problem even before the pandemic, where people just either think they are dangerous, they are part of a conspiracy, they are just not, they don't work. The bottom line is that we must base everything on science, just like with masks, Thomas. We know now that if you wear a mask, it reduces transmission dramatically. And with vaccination, we can get out of the hole that we're in right now.
And we talk about what's next here as far as this clinical trial, this vaccination. I know 30,000 people will receive it in about 2 weeks. Is that the final phase of this trial?
Well, that phase can take up to 6 months. So yes, if that proves to be a proof of concept, if you will, that patients who get this vaccine have safety and efficacy, then they will be ramping up production. Now, that's a whole nother can of worms, Thomas. How do we vaccinate the entire planet? How do we do that? Well, I think what's going to happen is there will be shared information. There will be manufacturing that will gear up with many, many different manufacturers all throughout the world to get this under control. And it's a matter of production and a matter of getting people to get the vaccine. If we can do that, then I think there is light at the end of the tunnel.
And we talk about the efficacy rate, as you mentioned. What would be an acceptable rate, 50%?
Anything better than zero, in my opinion, Thomas. I deal with this every year with the flu shot. And people will say, well, Dr. Mike, the flu shot was only 30% effective this year. Well, guess what? 30% is better than zero. And if it helps a certain percentage of patients get a more mild illness, then let's do it. Because right now we have nothing in terms of a vaccine. And this is really what we need to do to get through this.
One final question on the vaccination front. Is it possible we could see a vaccination in multiple doses?
Well, Thomas, there's a lot of unknowns out there. We don't know whether antibodies last, whether they're protective. There's some disconcerting news that came out this week from England showing that people who actually had the virus have, in some cases, antibodies that are not protective, that reduce in either efficacy or number after just 30 days. So there's a lot that we need to learn about this. But if it means that we get multiple vaccination protocols, fine. Let's do it. Let's make it happen. And let's move on with our lives. I don't know about you, Thomas. I'm kind of tired of the whole pandemic thing. I'm tired of the coronavirus. I want to move on, but it doesn't mean we just ignore the coronavirus like we seem to be doing. We have to deal with it head on in a scientifically proven way.
Have we been able to crack that very important question? Why do some people who are exposed develop symptoms while others don't?
Well, Thomas, not really. There are people, at least in my own practice, I have 80-year-olds who thought they had a cold and they were positive, and I have had 50-year-olds who run and work out and take care of themselves very well who ended up on a ventilator for a month. It really depends on the individual risk factors, how your body responds. We're seeing this with kids. Certain kids who had the virus end up developing this fairly dramatic immune response. Not in every kid does this happen. So we need to learn more, and boy, will we keep learning a lot from this. It's almost tantamount to trying to get to the moon, Thomas. If you think about it, yes, the objective was getting to the moon, but if you think about the technology and the learning and the knowledge and the rapid advance in education from that project, it had led to many, many, many different outshoots, if you will, whether it be calculators and all of that. So we're going to learn a lot from this, and there is a silver lining with this coronavirus.
Yeah, we're learning more and more every day. We see the studies that are coming out. I know there's new research. It was published in the Journal of Adolescent Health that found that 1 in 3 young adults, Dr. Mike, is at risk of severe COVID-19, and smoking plays a big part of that risk.
Well, Thomas, we've known that smoking and vaping are both not a good thing even before the pandemic came. And if you remember, there were upticks and outbreaks of young people developing severe lung disease, some of them needing transplants after vaping. And we were really looking into the chemical components of some of the vaping oils and material that went into the lungs. And so the young people who get this virus can get very sick, and those who smoke or vape are at especially higher risk of developing problems.
And we're also seeing reports that as far as our younger population, the young, not only are they getting sick, but they're experiencing symptoms longer. Do we know why?
Well, we don't know why. Many people are experiencing symptoms that are long-lasting. Some of the patients that I have taken care of, who I've seen in the office after illness, continue to have things like cough, continue to have findings on chest x-rays that indicate early fibrosis or scarring. So there's a lot to be said for the fact that there may be long-lasting effects, and not to forget the emotional toll that this is taking, not only in people who got the virus, but also the quarantine, the whole debate about school, kids being home, a decrease in their education and goals. All of that will have long-term effects.
Let's talk about schools for just a moment, and perhaps a myth versus fact here, because there are some reports out there who say our very young simply can't get sick. They can't be exposed.
Well, that's not necessarily true, and we know that for a fact that young people can get sick. Some people, young people can die, and some young people will need lung transplants. We've seen all of that. I'm not making it up. It's true. It is the truth. It is a true, okay? So that being said, we need to find a way to safely educate our young people and not have them get into trouble. But also, Thomas, and I'm a big stickler on this, our teachers, our administrators, our people that are involved with our children, many of them have underlying health problems. And in my humble opinion, they need to be educated on proper use of personal protective equipment, just like doctors and healthcare workers are. They need to be made aware and educated on proper techniques to protect themselves when they are in the school, and that means wearing masks, and in my humble opinion, protection for the eyes. When I see patients, I wear these. And the bottom line is that we know for a fact, and we've talked about this, Thomas, that the virus can get into the eyes and lead to an infection.
Yeah, your mouth, your nose, your eyes as well. So as a doctor, as a parent, do you think it's safe to send our children back in the fall?
Well, Thomas, the homeschooling issue was very challenging for my two children. I have a 12-year-old and an 8-year-old. And so I believe that if we do it right, if we stage it properly so that there is social distancing, kids need to wear masks that are high quality, that are cloth, that are 2-layer, that are high thread count, that even may involve 2 different materials like cotton and silk or cotton and flannel. If we do that, I think we could get through this safely, but it's going to be challenging, unprecedented, and really a frontier. We are learning. We're all going to learn. We're going to make mistakes. But the bottom line is, I think it's in the best interest of everyone to try.
Yeah. And a reminder to parents, once again, I mean, talking about the symptoms in our young here, they have developed an inflammatory syndrome very similar to Kawasaki disease.
Thomas, if I have a child, especially if they're in a school setting, they develop a fever, we are not going to say, well, it's just a cold. In this day and age, I want my patients to call me with any symptoms of upper respiratory infection, fever, muscle aches, rash, anything like that needs to be dealt with immediately, because the earlier the diagnosis in that particular condition, the children's multi-system inflammatory syndrome, that needs to be dealt with early on, and better outcomes occur when it is dealt with, diagnosed, and treated early on.
And as we head toward the fall months here and back to school, who's eligible, who's should be getting a flu shot this fall season?
Everyone over the age of 6 months is eligible for the flu shot, and everyone should get it unless there is a good reason why. You can't, whether it be that you had an allergic reaction to it before. There are conditions like Guillain-Barré where you have an immune condition that maybe precludes you from getting it. Those are the types of patients that you worry about, but leave that to health providers and experts to decide whether your loved one should get it. But the bottom line is, for the vast, vast majority, we all need to get the flu shot.
Something to consider. Our daily reminder, Dr. Mike, on staying safe.
Well, Thomas, I want to mention this. There was recently a study looking at 2 hairstylists who treated a large number of people, cut their hair, styled it, just like you, an amazing hairstyle. And the bottom line is that they wore masks and they did not transmit the virus, even though they were later found to be positive for the virus. So my take-home message today, Thomas, masks. Everyone needs to wear a mask. It is the way to go. Social distance, mask, wait for the vaccine, and we will get through this.
Added layer of protection. Dr. Mike Sirigliano out of Penn Medicine, Philadelphia. Great to see you, Dr. Mike.
Always a pleasure, Thomas. You take care.
For an important announcement, and we have 2 people. Dr. Levine is with me, and we have Dr. David Rubin, who's going to be on too. On TV soon. So let me start. During the past week, we have seen an unsettling climb in new COVID-19 cases throughout Pennsylvania. During the past week, that has especially been bad. When we hit our peak on April 9th, we had nearly 2,000 new cases that day, with other cases hovering around 1,000. That was our peak, 2,000. Medical experts looking at our current trajectory are projecting that a new surge is in the offing. And what we're seeing right now could soon be even worse than what we saw before. We had 994 cases just yesterday in Pennsylvania. So before, we succeeded at flattening the curve back in the spring. And we did that by working together, all of us. And we actually broke transmission links. So we got down to the point where we were actually in the 300 to 400 new cases per day. And Pennsylvania, as you recall, was one of the continues to be, but still was one of the best states in the country when it came to dealing with the COVID virus. We didn't know as much about the virus then as we do now, so we had to take a broad approach, sort of the blunt instrument approach to eliminating points of contact. But with our current rapid increases, we need to act again, but this time we have more knowledge and we can act in a more focused manner because we have a better sense of how this virus is affecting Pennsylvanians. Through contact tracing, we've identified 3 catalysts for our case increases. This is where we think the case increases are coming from. First, some Pennsylvanians have been ignoring the mask-wearing requirements and social distancing when they're visiting Pennsylvania bars and restaurants. They are unknowingly spreading or unknowingly picking up the virus. And this carelessness has resulted in pockets of super spreading. Second is out-of-state travel, both by Pennsylvanians who are returning from places they visited out of state and by out-of-state folks coming to Pennsylvania to visit us here. And the third catalyst for this new upsurge is a lack of national coordination. And that has resulted in states in the South and Southwest especially not committing to the things they should have done to keep this virus from spreading. Unfortunately, this virus does not respect state boundaries. And so we are paying the price in different ways for what states and other places have not done. We see that, for example, in testing. Sometimes takes as many as 10 days to get test results back. And that's not because of anything we've done. It's because testing, national test places are being overwhelmed by the cases that they've seen in these other states. We're paying the price. We did everything we should have done. We were responsible, and yet we're paying a price right now. So the result is that other states have become petri dishes for COVID-19 during the time when we were all working hard here in Pennsylvania to suppress the spread. Some of these states actually now have hospitals at maximum capacity due to the COVID-19. And this virus knows no boundaries, no borders, as I said, so it's been spreading northward and eastward across the country and has reached our Commonwealth once again, this time from the west, the south, and the southwest. Together, these 3 catalysts have turned our downward trend into an alarming escalation. And we're already at a tipping point where we really have to act. We don't want to become Florida. We don't want to become Texas. We don't want to become Arizona. We have got to act now. So today I'm going to be signing an executive order that will implement the following mitigation efforts across Pennsylvania. First, restaurants will reduce their indoor capacity to 25%. The current outdoor dining rules remain in effect just as they are. Second, on-premises alcohol consumption will be limited to service with meals only. Cocktails to go and carry-out beverages are allowed. Third, telework must be implemented whenever possible. And fourth, indoor gatherings will be limited to 25 people, and outdoor gatherings remain at a maximum of 250 people. As I've said, we are using the information we have gathered over the past few months to create these mitigation efforts based on how the virus spreads, how it's spreading in actuality right now in Pennsylvania. We know that the virus appears to be primarily airborne, so we're placing more limits on indoor activities. We know that the virus spreads rapidly in crowds, so we're limiting crowd sizes in situations where people are likely to gather close together, such as bars. This is the virus speaking. The virus is making the rules here. We're just trying to anticipate what those rules are and doing what we can to reduce the risk that that virus is going to do a lot of damage in Pennsylvania. Now, these new mitigation efforts are in addition to existing actions. They don't take away the importance of our personal responsibility to do our part, each of us, 13 million Pennsylvanians, to reduce the possibility that we are spreading COVID-19. That includes wearing a mask when we're out in public. It includes washing our hands, using hand sanitizer frequently. It includes social distancing as much as possible. We have seen these efforts work during the first wave in the spring. They worked. And they're going to work again if we all do our part. So I want to say thanks to every Pennsylvanian for your continued patience and your support. I know all of us, I am and you are, eager to get back to life as normal. That's the way it goes. But this is what we have to do. It may feel like a step backwards, but it isn't. It's just a reminder that we need to get back on the course of mask wearing, social distancing, and successfully mitigating COVID-19. Pennsylvanians should consider that even with indoor dining limited and bars closed for on-premises alcohol consumption, cocktails to go are still permitted, and there is no shortage of outdoor dining options. Small gatherings of friends in the backyard or at a local park, they're still permitted. And children and families are encouraged to responsibly take advantage of one or more of the 120 Pennsylvania state parks or other outdoor local and local fitness options. Children can visit local playgrounds, community pools. They can enjoy outdoor activities with their families. Gyms and fitness centers can remain open and are encouraged to offer more outdoor fitness options. I want people to spend time together, but I want them to do so while they're practicing social distancing, while they're wearing masks when required. When you leave your home and you're not participating in an outdoor fitness exercise, wear a mask. Every minute that passes is one closer to the end of this pandemic. That's what we're trying to achieve. And many researchers and many medical professionals are working diligently to find more treatments, maybe a vaccine, maybe a cure for COVID-19. So thank you, Pennsylvania, for everything that you've done, every sacrifice you've made. Let's keep working together. Let's keep working together as I know we can to protect ourselves, families, our friends, our businesses, and our communities from a further spread of COVID-19. Now I'm going to turn things over to Secretary Dr. Rachel Levine. Secretary Levine.
Good afternoon. Thank you, Governor, and thank you for your leadership and support. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 994 new cases of COVID-19 being reported, and this brings our statewide total to 97,665 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, 6,957 deaths have been attributed to COVID-19 now in Pennsylvania. As I explained on Monday, we have seen case counts increase in 43 counties in Pennsylvania, and the percent positivity rate has increased in 28 counties over a 7-day period. Over the last day, we have recorded our single highest day in tests being completed, with more than 28,000 test results reported. Currently, we have a total of 649 trained contact tracers across the state, including our community health nurses, local municipal health departments, and our committed volunteers. And we're working to increase that every day and every week. Through all of these efforts, we are still seeing alarming increases in cases of COVID-19 in 19 to 24-year-olds throughout Pennsylvania and in 25 to 49-year-olds in Pennsylvania. The actions that the governor and I are taking today are designed to be surgical and precise to prevent repeating the cycle that we saw in the spring. As the governor mentioned, we have gained a great deal of experience since the start of this outbreak, and have learned best practices from other states and counties in Pennsylvania. New York and New Jersey, as well as Allegheny and Philadelphia counties, have taken a similar approach. In addition, states like Texas, Arizona, Florida, and California in the past have not taken this approach and are now seeing the surges. This action is necessary now to stop the spread of COVID-19 and stop the disease transmission cycle from repeating. We know what will happen if we hold fast and wait until cases rise exponentially before taking action. The numbers would continue to increase and our entire state would then potentially have to quarantine. And so by acting now and making these specific and targeted mitigation efforts statewide, we can get ahead of the curve and ensure that not only will our hospitals and healthcare system be available to patients, but that our economy will survive while still saving lives. There are things that you can do right now to stop this cycle. First, wear a mask. Really, if you're thinking that you might need to wear a mask, don't think so hard. Wear the mask. If you're in a store where people are not following the mandatory mask order, make a choice to leave. If you're getting together with people who've been pretty vocal about not changing their lifestyle and are refusing to wear a mask, make a choice not to see them. As much as our efforts are about laws and mandates and orders for safety, they're also about your choices. Pennsylvanians want to be at work. Pennsylvanian children want to go back to school. But it is our actions as a community that will impact our ability and their ability to do those things. So be safe. Adapt your activities to protect against COVID-19, and please wear a mask. Here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Please use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And please don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your healthcare provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you care about needs help with a substance use disorder, please call the Department of Drug and Alcohol Programs Get Help Now hotline at 1-800-662-HELP. Again, 1-800-662-HELP. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to now remember is stay calm, stay alert, and stay safe. And now it is my pleasure to introduce Dr. David Rubin. Dr. Rubin is a pediatrician. He is director of the CHOP Policy Lab and director of Population Health Innovation at the Children's Hospital of Philadelphia. Dr. Rubin.
Governor Wolf, Secretary Levine, thank you for having me today. As the director of our policy lab and our population health program for health system at the Children's Hospital of Philadelphia that sees over 600,000 children and adolescents every year, our teams mobilized very quickly in March and April to begin developing local area forecasts at the county level, because even though it was extremely important that we have national and state data that really impressed upon our communities the magnitude of what was coming, it was also important, we foresaw, that we would need to develop local area knowledge so that we could get areas opened as soon as possible and as safely as possible. At CHOP, we represent the interests of working families. We knew that our families would be facing the direct impacts of COVID, particularly to caregivers. We have a lot of grandparents throughout the state, that our teachers and our staff within the schools would be thinking about their own risks, and that children did not live in a vacuum. And as much as we knew that we needed to get families back to work and children to schools, we also recognized that we had to do it as safely as possible. The models that we have now developed, which forecast the disease activity and particularly the viral activity throughout over 500 counties in the United States, and which can be found at policylab.chop.edu, along with other resources for families, have actually allowed us to understand how this virus moves across the country and how it sometimes and often spares rural areas, and even as we struggle in some of our more urban areas. The modeling has also helped early on. We were one of the centers that were really trying to challenge state governments to reopen some areas safely that were ready, even as our cities remained more cautious and were struggling with disease activity in their local areas. Our models now have been helpful to the White House Coronavirus Task Force as we've been helping them to understand potential impacts of stronger mitigation strategies to try to curb this next wave of the epidemic that has been sweeping the country. And so for a long time, we've helped advise and consult to both state and national leadership to help people make important decisions that affect the lives of people every day. But we also promised that we'd be back if we saw incontrovertible evidence that the resurgence was coming. And sadly enough, I'm here today to let people know that that evidence is now extremely clear. And even as we focus on Texas, Arizona, Florida, and other areas of the Southeast and Southwest, it is very clear that the disease resurgence is moving quickly into the Northeast region and to the upper Midwest. And if I can share my screen, I'm going to show you exactly how we don't rely on single pieces of information to make that assessment, but we see it through neighboring regions. We see it in multiple counties sharing the same disease resurgence, and we see it in our testing positivity rates, as Secretary Levine has discussed. The goal here, I would remind everyone, the goal here is we have about 6 weeks left in summer, and all of our school reopening plans, of which our teams at CHOP have been very much involved, are entirely dependent on us keeping disease transmission down so that we instill in our public the confidence that they can safely put their children on a school bus and return to school, and that our teachers and our staff can feel that they will be safe when they go to educate our children. So with that, I'm going to try to share my screen, and if I can't, I'll give you the general comments, and I'm going to start by focusing in on Allegheny County. So I'm going to assume that that people in the room can see what I am sharing now on the screen. Is that correct? Lacking someone tell me otherwise, I'm just going to start preparing my comments. The
No,
graphs
we just see you.
Oh, you just see me, so you can't see my screen. Let me try. So I don't think this is going to work on the screen here, so I will just contextualize the comments. Over the last couple of weeks, we've seen significant disease resurgence in the Pittsburgh area, not just in Allegheny County, but in the neighboring counties around them. We have applauded as we've watched people in the Pittsburgh area begin to distance more and do a lot of the individual activities that Dr. Levine has spoken about today. And they may, in fact, be curbing the epidemic that is quickly spreading there. However, this was not an isolated outbreak. Prior to the resurgence in the Pittsburgh area, we've seen multiple cities now in the state of Ohio, including Cleveland, including Columbus, Ohio, with significant resurgence that continues to climb. They have widespread community transmission, which is washing over our western border of Pennsylvania in waves, particularly as people travel in a season of American vacations. And if that were only the case, we would have enough to be concerned about what was coming east. But even more worrisome now is a lot of the pressure from the south is really moving quickly up the I-95 corridor. We're seeing increased disease transmission in the Washington, D.C. metro area, in the Baltimore, Maryland area. Those areas just a couple weeks ago looked much more like us or New England, where it was fairly quiet. And within a couple of weeks, they now resemble more like the cities in North Carolina that have lost control of the epidemic. For people to view on our website, the Virginia Beach projection for the next 4 weeks, we'll see what epidemic transmission looks like and how quickly cases can grow within a region. Over the last week or two, we've now also been watching very closely the Philadelphia area, and it is very certain over multiple weeks that the collar counties and the surrounding counties in southern Jersey are all now reflecting increased diseased activity and are conferring risk as well to Philadelphia proper. This last week or two, we've seen elevated transmission rates in throughout the Philadelphia area, and we're seeing very clear evidence of increasing case identification in Philadelphia. This is also not isolated to just Philadelphia and to Pittsburgh as well. Because of the increased risk now and transmission we're seeing throughout the state of Maryland, up the Route 15 corridor towards Harrisburg, we are now seeing significant pressure on York County and into central Pennsylvania. Simply stated, we are seeing now widespread community transmission throughout the Northeast area. It's also extending up into northern New Jersey as well. And it's of sufficient concern now that if we do not act decisively in these next 6 weeks, we may not be in the favorable terrain we had hoped to be in to be able to convince the public and to assure the public that opening schools will be safe after Labor Day. Make no mistake, the time is now for action. And I'm going to hand back the decisions and the questioning back to Governor Wolf, to Secretary Levine, and I thank them for having me here today. I'd be happy to answer your questions as well.
Questions? Yes.
So, why is this a statewide order after you previously stated that you were going to take a more targeted approach to counties that were seeing increase in cases? Obviously, the more rural counties are not seeing the same influx in cases. Why are those businesses being forced to occupy with the same limits as businesses in larger counties with more cases?
Okay, first of all, this is a very targeted approach because we know more about the disease, because we have contact tracing. We know where this disease is spreading from. We also know that the disease is not respecting boundaries, county, state, national boundaries. So we are trying to do what we need to do in a targeted fashion. As for the geographic spread, most of the counties in Pennsylvania actually are seeing an increase, not to the extent that Allegheny County or Philadelphia County, but this is something that extends across the Commonwealth. But as Dr. Rubin and Dr. Levine said, we're trying to make sure that we do things we need to do right now so that when schools it comes time to open, we get back to the fall, that we're in a position to do that. Again, we're trying to follow the dictate of this virus, and this virus is saying, I'm back. And you might have done everything you needed to do in Pennsylvania, but you couldn't control what happens in these other states. You couldn't control who's going to be going across your state borders. You couldn't control who's going to congregate in bars. I don't like this any more than anybody else does, but this is what we're trying to do. This is what we need to do if we want to stop this in its tracks right now, so that by the time we get to the opening of schools, we can do that. I don't know, Dr. Rubin or Dr. Levine, you want to say anything?
Well, to echo the governor's comments, I think that, and the data that Dr. Rubin is presenting, I think the threat is statewide. And so that is why this is a statewide effort. And as the governor said, this is a targeted mitigation effort. This is not red, yellow, green, where many, many different segments of the population were affected. We're really looking at the data, not only in Pennsylvania, but the data nationally is that the virus is starting in younger people, so the 19 to 24 age group, but also the 24 to 49 age group, and that is particularly being spread, and sometimes in these super spreader events, in restaurants, in bars where people are not practicing social distancing, they're not masking, and they're putting themselves and their families and the community at risk. And that's what we've been seeing in Allegheny County. We've had extensive discussions with Dr. Bogan, have strongly supported the mitigation efforts that Dr. Bogan has put in place, strongly supported the mitigation efforts that Dr. Farley in Philadelphia has continued, actually, over the last number of weeks. And I just want to contrast the efforts that Governor Wolf's leadership is taking in the administration to Florida. Because in Florida, you can see what happens when you don't do any mitigation efforts and you basically let the virus burn. And so they are seeing, last week was, Saturday was over 15,000 cases. Yesterday, I think it was over 10 or 11,000, close to 10,000 today. You can see that their hospitals are threatened in many different areas around the state. Their death rate is now increasing. That's what happens when you just let this burn. We cannot be Florida.
And if I could just follow up, what if this, people are going to be asking, I'm sure, what if this doesn't work? What if we don't get to where we want to be? Are we going to see more businesses affected or an occupancy limit, brought down further? Because many of these restaurants will say, we can't survive at 25% occupancy.
So it is absolutely, and the governor can speak about this as well, extremely challenging for those businesses and for the people and the employees and the owners of those businesses. And we certainly realize that. But this is where the virus is spreading now, and this is where we have to take action. It's hard for me to predict what we're going to do in the future. We are positive and optimistic that this action will be successful, but we cannot be Florida. We will not let the state go to be Florida and letting it burn, and so we'll do whatever is necessary. But this is what is necessary now. Governor?
No, I couldn't agree more. I keep saying, this whole process, we've had an array of choices, and they've all been bad. What we've been given is what the decision as to what's the less bad option. Clearly, this is a bad thing for the businesses we're targeting here. The question is, would we be in even a worse position if we allowed what happens in Florida, where no one's going to restaurants, they're not going to bars anymore, and as long as the hospitals are being overwhelmed, they're not recovering from the disease. I mean, none of those things is good for any part of any economy. We're trying to mitigate, and yes, it's focused and targeted right now. It's a bad thing. Let's hope we do this and get through this phase as quickly as possible. If we do nothing, I can guarantee you we'll be looking a lot more like Florida than we looked like Pennsylvania by acting decisively early on. I want to get through this, and we need to get through this quickly. This is where the virus is being spread, and that's where we need to do our work. Yeah.
You mentioned that a lot of these mitigation efforts are targeting indoor events, but as Dr. Rubin said, there's only a few more weeks left of summer. What's going to happen when it starts getting cold? Do people need to plan that they're going to keep staying outside, or will they be able to have more things inside?
Yeah, well, two things. First of all, we're trying to actually stop this virus in its tracks. And right now, because we are taking, we have the information that we know where this seems to be spreading, we're targeting that right now. If we do that, we don't have to be as focused on this when we get into the return to school. And that's the hope, that we can actually do what we need to do now so that we don't have to, I mean, we don't want to wait another 4 weeks. Let's act now in the hopes that this makes it so that we don't have to do draconian things when we get to the fall. Yes.
The spreading of the virus, the first cases appeared here, and the numbers of the cases started escalating quickly. It seemed like the overriding goal was to protect the healthcare system, to limit the virus spread so the healthcare system wouldn't be overwhelmed. The last 10 days or so, the hospitalizations in Pennsylvania, according to the dashboard, have been pretty steady. They haven't skyrocketed, they've been steady.
That's right.
So if the state's hospitals are doing pretty much okay, why do a statewide measure?
First of all, the objective is to keep people safe. And one of the means to doing that is to make sure that our healthcare system, just one of the means, was to make sure our healthcare system, do everything we could to make our healthcare system not be overwhelmed. And we did that. And I think you're right. Right now, we're doing that. If we don't do anything right now, if we do what Arizona and Texas and Florida did, we're going to see that healthcare system, just as they are, being quickly overwhelmed. We don't want to get to that point. So that wasn't the goal, but it was a means to the goal of keeping people safe. So far, we've done a good job, and I think our healthcare system is in pretty good shape. We are, remember when I keep bringing this up, we were using ventilators as a reflection of how many, how many ventilators were we using compared to how many we had. We have 5,300 and some ventilators out there in the healthcare system right now. As of today, we are only using 88 of them for COVID-19 patients. Now, part of that's because the standard of care has changed. The part of it is because our healthcare capacities, we have millions of N95 masks and millions more on the way. We were concerned about gowns. We now have over 1 million, maybe 2 million gowns. We're looking for warehouse space. Hospitals and healthcare systems can't take any more inventory because they have a lot of inventory. So we have the capacity now, and I think that's a good thing. We don't want to get to the point where we were concerned back in the early stages that our healthcare system would be overwhelmed, because that would be one more reason why this virus was going to overwhelm us. We're trying to keep people safe. We're trying to keep people safe here with what we're doing right now. And part of that is to make sure that we don't let our healthcare system be overwhelmed.
Follow-up, the Associated Press reported that the county governments have received an email from your office saying that bars and restaurants that are not serving meals will be closed. Are you closing bars or ordering bars and restaurants that don't serve meals to be closed?
Yes.
Okay.
But I call them nightclubs. I mean, I think if you have a place where you can go get a hamburger with the beer, that's fine. I don't care what you call it yourself. But if you're just a dive bar or a nightclub and all you do is serve drinks, that's not going to work. Yes.
I'd like to get Dr. Levine's latest assessment and perhaps Dr. Rubin.
Yeah, why don't you pick on Dr. Rubin a little bit here too? That'd be great.
Regarding this surge that we're seeing,
yeah.
what is your latest assessment on what is happening in terms of the medical impacts? Are you seeing any signs whatsoever of people getting sicker or the death trend go up or
this is for both of you.
Sure. So I'll speak briefly, and then I'm going to toss it to Dr. Rubin. So there have been some increased hospitalization rates in Allegheny County, but you have to understand that all that gets delayed, meaning you don't usually contract COVID-19 and immediately get so sick that you have to go be in the hospital. First of all, the incubation period of the virus is 2 to 14 days, on average 5 days. And then after a number of maybe a week or 2 weeks, then you're getting sicker and sicker and you end up in the hospital. And then if someone tragically might pass away, often that can be several weeks after that. And so that is what Florida saw. Florida saw increasing numbers, and then a time later, several weeks later, now that their hospital system is challenged, and then now they're just starting to see the increase in deaths in Florida. So any report, I want to clarify this, any report that the virus is less severe or less virulent, I completely disagree with. There is no evidence that the virus is less severe or less virulent than it was before. In fact, there is some genetic evidence, although it's controversial, that it's actually somewhat more contagious. That the variant that we're seeing, primarily that came from Europe, might be a little bit more contagious. But I think that we have not seen the hospitalizations because until the last number of weeks we didn't see the numbers. Now they're starting to see some small increased numbers in Allegheny County. And we, as the governor is saying, we don't want to wait until exponential growth is going up and then our hospital system is challenged. Dr. Rubin.
Yeah, I'd like to just add a couple of things because at Policy Lab we've had the benefit of watching the cautionary tales of what's going on in the South and other regions of this country. We've worked very closely and hard to get communities reopened and keep them open, and it's been one of the an extremely common calculus is we're going to keep pushing through our gates until we see our hospitals that full, and that has been a rabbit hole. Has not worked at all. Leaders in the South have failed to recognize these increasing transmission rates. And the time for action is when you're doubling from 50 to 100 cases, not when you're doubling from 500 to 1,000 cases a day. We've also seen transmission cycles now where younger people are getting infected and then infecting older people in their community due to people being fatigued, et cetera, not distancing enough, which has been the most important strategy that we have. And that, again, delays the hospitalizations rising. And the problem that happened in Texas and in Arizona and now in California and in Florida is by the time their leaders recognized, oh my gosh, we're 85% full, they're in the thousands. And those thousands are doubling every day. And when that happens, you get overrun. So waiting for the hospitals to fill is not the way to try to use a dimmer switch. The fuse blows on a dimmer switch when you're in the thousands of your cases daily. The time for action is now. And with the urgency around school reopenings just around the corner, if we do not get community disease transmission rates down, we're really threatening the most important reopenings that we have coming around Labor Day.
Governor? Yes.
Governor Wolf, you said earlier that it's imperative that Pennsylvanians do their part, but just like we've seen since the beginning of the pandemic, there are people who aren't going to follow that. So what about the nightclubs and the bars and the patrons that visit those locations? Is there going to be a consequence to not doing what the order states?
Yeah, there are legal consequences. We actually have liquor enforcement officers that have made thousands of inspections and actually issued some warnings. For the most part, though, most establishments have actually done the right thing. Second thing is that I think, I don't know if you've all noticed, but more and more people are wearing masks out there. And more people are, again, I think it's like seatbelts. More and more people are saying, yeah, I don't like this any more than you do, but that virus is out to get me and I want to reduce the risk. And so more and more people are doing the right things. And I think part of what is going to happen is that people are just going to say, I don't want to assume the risk of getting this disease. So maybe instead of going to that nightclub tonight, maybe I'll stay home. And the more people who decide that, the better we're going to be. And I think that's what's happening. Right now, when this whole thing started back in March, we were in a very different place than we are now. Right now, people are wearing masks. People are actually looking out for each other in a way that they weren't just 3 months ago. And I think we're learning about, the more we learn about this disease, the more each and every one of us, 13 million Pennsylvanians, are doing the right thing. And as we do the right thing, I don't care what your economic incentive is, you're going to find it hard to remain open. You're going to be shamed into doing the right thing. Are there going to be exceptions? Absolutely. Are there going to be places that no enforcement officer has the time to go to? Sure. Are there going to be places that figure out ways to skirt this? Yeah. But for the most part, we are moving more and more in the direction where all of us are, in fact, working together to attack and defeat this virus.
And Governor, follow-up to that, what should residents do if they want to call out that person? Because that's a question we're getting in the newsroom all the time, is where can people report businesses and individuals who are not following guidelines?
That's a great question. I think individual residents, if they see something that's wrong, they ought to report it. And the more they report that, the more the people who are responsible, law enforcement, state law enforcement, are going to do something about it. I think one of the things that happened early on is nobody was standing up, or few people were standing up, and so someone would say, hey, I'm going to be a tough guy, I'm going to stand up, I'm going to open up, this is my First Amendment right, or whatever. And it's like, I think if someone stands up and says, I don't think you ought to be doing that, you're going to be finding more and more people saying, yeah, I think you're right. I want to do the right thing here. That's what we're really aiming for. This is going to work when 13 million Pennsylvanians, all of us, decide that we want to hold on to our lives, we want to reduce risks for our loved ones, our neighbors, our coworkers, all those things. And as that happens, I think you're going to find fewer and fewer people, as we're already finding, want to violate the law. Yes.
Is that me?
Yeah.
Thanks. So thanks for being here. I wanted to ask about testing. The last time I was here was in May, and that was where Dr. Levine said that one plan for the fall was or plans for the fall included having rapid response testing.
Right.
I was just wondering, is that still, are there still Pennsylvania firms working on that?
No,
is that
absolutely.
likely for the fall?
Absolutely. We thought it was going to be August. I'll let Dr. Levine talk about it, but this is something we are working on. We actually have the Department of Community and Economic Development working with a specific company. We're taking a gamble here, but focused on a Pennsylvania company where we control our own destiny and say, we want a rapid turnaround test. What does it mean when you get tested and it takes 10 days to get the result? The answer is it means nothing, because within that 10-day period, you might have tested negative. By the time you get the test results back, you might be positive, but you don't know it. So we need to get a test that's easy to administer, hopefully oral, that you can do yourself, and where we get an accurate response or results within, say, 15 to 20, 25 minutes. We're not there yet. There is no place in the country that's there yet. The company we were working for originally, we thought maybe we could get it by August. It looks like they're now saying October. we're not holding our breaths, but we need to work on that, and that's the kind of testing we have to get toward.
What's the company?
It's called, am I allowed to say this?
I don't know.
I don't know.
Was it publicly bid? How did you choose the company?
That's a good question. We'll get back to you and figure out how we did that. This again, this is one of those areas where I'm trying to move as quickly as I can, not go, wait and spend a lot of time. So I am sure if there were some things that we did that moved faster than in ordinary times, I'm sure that we did. And it is a gamble, and the hope is that it works for Pennsylvania. I'm trying to keep Pennsylvanians safe, and this is something we desperately need. Every state needs it, but we need it here in Pennsylvania. We cannot, as we're seeing right now, we cannot continue to rely on national testing organizations. Yeah.
Governor Wolf, I have two questions. One, logistically, you can answer yes or no. So even if bars have like outdoor seating, but they don't sell food, does that mean they're still going to be closed for this?
The order is even if you're outdoors and you're serving alcohol, you have to serve food with it.
Okay, that's great. And the next question is, I know that 6 weeks from now we have that benchmark of the school year opening, and I know many teachers are concerned, thinking that they won't be safe going in the building, but lots of parents are concerned because they need their kids to go. It's obviously, I don't want to tell you,
Yes.
huge issue. Are you prepared to pull the plug on the school year in person if we don't reach these benchmarks and we still keep going up and up?
Yeah, I mean, ultimately, I don't think it's going to be me pulling the plug. It's going to be exactly what you said. Teachers not wanting to come back to school. It's parents not wanting to send their kids to school. The same thing is happening in universities. We can wave all the magic wands we want and flick all the switches we want. If they don't make individual decisions, I feel it's safe to go back, they're not going to go back. And that's why what we're doing here is so important. We need to nip this in the bud. We cannot, as Dr. Levine calls it, let it burn like Florida. We've got to take decisive action so that we have a fighting chance to be able to get to a point where parents are going to feel comfortable and confident that they can send their children to school. Yeah.
Governor, thank you. The Red Cross, as part of the testing that you all have, is now doing the antibody testing. There's a concern that those cases would come back as a positive, which means they've had COVID, now they have the antibody. Can you give Pennsylvanians an assurance that those numbers are not being counted twice as a positive COVID and a positive for antibody?
I'll turn it to Dr. Levine too, but yeah, we actually, I think that came up back in March or April, and we are not, we understand that there are two different types of tests, but a negative in one is not the same thing as a negative in the other, and you can't conflate those things.
Sure. So first I'll answer that, and I just want to mention about the general testing. So we know exactly who has the antibody tests, and we know exactly who have had the PCR tests, and so we don't double count them. But also I want to emphasize is that the any antibody test results is listed as a probable case. And so we only make decisions when we're deciding about mitigation and other factors. We're only making those decisions based upon confirmed cases, and that are only the PCR results. And so it is, and we separate it all in terms of our website. So it is apples and oranges. We're only looking at confirmed cases when we look at county case counts or regional case counts and things when we're making any type of decision like we're making today. And we make sure that we don't double count when we look at our total numbers. I also want to mention in terms of you mentioned about the testing. So, we have reporting 28,000 tests. That's the most we've ever reported that have come back today. That's very good news that we've been increasing our testing. We've increasing our testing in terms of our community testing, but also we are testing every patient and every staff member in every nursing home in Pennsylvania, and we're working to complete that by the 24th of July. And then we're working with the Department of Human Services to test every patient and every staff member in all the other long-term care living facilities sometime in August. And then we're going to retest on an individual basis depending upon the results and then their location. And so we're very pleased with the increase in testing. We've worked with many other companies such as Rite Aid and Walmart and CVS in terms of testing. So we have a capacity to do about 1,000 tests a day at our laboratory in Exton. Those are priority tests that we do, for instance, with a priority nursing home might have some issues, and we get those back in 24 to 48 hours. The hospitals and health systems, of course, do their testing. They get those results back in 24 to 48 hours. The concern that the governor was mentioning is the national testing laboratories. So, many community tests, they're being obtained at potentially a federally qualified health center or one of the companies that has testing. They're sent to national companies, for example, Quest and LabCorp. Now, they are doing a fantastic job, but they are overwhelmed with tests now. I mean, it's particularly tests coming from California, from Arizona, from Texas, from Florida, but not only those, and Dr. Rubin could probably tell us the other states that are particularly impacted and affected. So the lag time for those national test results has crept up to a week, and then sometimes more than a week, 10 days, and that limits the utility of the results, as the governor was saying. We do have calls in to LabCorp and Quest to talk about the challenges and to brainstorm with them, but this is a national issue in terms of the number of tests that are coming to these national companies. And we'll really need a national response in terms of helping them decrease their decrease the time in terms of we get the results.
The cases that are reported every day, can you give any kind of sense of how up to date that data is, if we're seeing this lag, how are the lags affecting our new case counts, and is there reason to believe that case counts are really higher than they are, or will surge as we work through the backlog?
So, most of the labs are not 2 weeks, most of the test results are not 2 weeks out, but many of them are certainly within the last week. But there are concerns with that lag time. Dr. Rubin, would you like, you had talked about your concerns about the test lag time.
Well, we used to think that, wherever you were today or what you saw today in your tests, you're probably 2 weeks behind. And, with the increasing lag times and increasing reports of people waiting 7-10 days, first of all, at the individual level, it's hard to make decisions about how to get kids back to school or people back to work based on those types of decisions. And people live with a lot of anxiety. That's bad enough as it is. But from the perspective of trying to be ahead of this epidemic, when you add extra delays to the tests that we're not now seeing because of the surges in the South, that means we may be further behind than just 2 weeks. And so whatever we're seeing today, we're probably a few weeks behind what's actually happening on the ground. And that should worry us, and why we need to be a little bit more decisive and ahead of the game, if you will, in terms of responding right now.
Yes.
The 25-person indoor limit apply to religious institutions?
No. Governor?
No.
John?
That was actually the question.
Plagiarism. Yes.
Right now, the hospitals right now, the health systems are really making a case, like right now, to try to persuade people to come to the hospital. Do you have, in light of what we've been talking about today, do you have any concerns about that right now?
Let me let me just say that actually is a problem with restaurants and bars and retail establishments and manufacturers who want to give the people who either work there or are going to be customers or patients or students the confidence that they can come back. This is a general problem, and the problem you're talking about is one that I've heard a number of hospital executives talk about, and that is, how do we get people confident that they can come to, of all places, a hospital, to be treated for things that they might just sort of let slide and stay home. They're afraid of going to a hospital right now. They're afraid of doing so many things. This is why what we're doing here is so important. We've got to take steps to actually build that confidence that we can get back to as close to normal as we possibly can, and that's what acting decisively and early right now is. Dr. Levine?
So I would agree with the governor 100%, is that we want people to get the primary care and the other services that they need. We want people, if they have hypertension, if they have diabetes or heart disease or lung disease, to see their doctors. We want children to get their pediatric visits and to visit their family physicians. We want children to make sure they get their necessary immunizations, which is absolutely critical. So we want all that primary care and all that secondary and tertiary care to continue. We want want them to feel safe to be able to go to the hospital, to have quote-unquote elective procedures. That elective doesn't always mean that it's really elective, but it's something that could wait a couple weeks, but then has to be done. So we support the hospitals completely. We want people to see their physicians and their healthcare providers and to get the care that they need, which, as the governor said, highlights why it's so important to put in this targeted mitigation now so that we don't threaten our hospitals the way Florida has, where now they can't do those. And they've started in Texas in some areas. They're starting in Arizona, the crisis standards of care, because their hospitals are overwhelmed and threatened. If you wait to that point, as Dr. Rubin was saying, you've missed the boat. Dr. Rubin, would you like to comment?
Yeah, a couple things. I remember. I just wanted to note that back in March and April, when I returned to my own pediatric practice, I remember being terrified. I think all of our staff were as well. Our nurses, our nursing assistants, we were worried. I mean, no one. Yeah, we all felt the same way, terrified that we were going to a very uncertain environment. And then to watch what Children's Hospital did and what our health providers did to provide the adequate protective equipment, the protocols, and the decision-making really helped relieve a lot of anxiety. And I think of the same way for our teachers. I feel safest when I'm at my practice right now, and Pennsylvanians should feel safe going into your healthcare systems. They've worked very hard to make it a safe environment, and their protocols are pretty impressive. But I also say to the teachers out there, our job as Pennsylvanians is to get our case transmission rates down. That's step one. To reduce the disease burden so people feel safe and the likelihood that they're going to accidentally get infected goes way down. The second thing is to say is to have strong protocols for masking and distancing in your schools. And if you feel confident about your protocols, and with low disease transmission, I think our teachers and our staff should feel just as safe as our nurses and our nursing assistants and doctors do when they walk in the doors of the Children's Hospital of Philadelphia.
It sounds like you don't have any immediate concerns that we're headed for a capacity problem then.
The goal, as we've been saying, is to prevent that, which is why we're putting the mitigation.
I have a concern about that. If we do nothing, we are going to overwhelm our healthcare system. That's why we need to act now. One of the reasons we need to act right now. Okay, thank you.
One quick question. A lot of people in the legislature support a bill about the right to know law and it being effective, or right to know request being answered during an emergency. Earlier in the spring, you said the process is secondary was going on. Will you sign that bill that the entire House approved and that is moving forward in the Senate now?
No. I think that bill has some flaws. I am for transparency, and I will stack my record of transparency up against members of the General Assembly any day of the week. I think that particular bill has some flaws. Let's actually get to a point where we are transparent. And by the way, we are answering all right to know and open records, I think, right now. Is that right?
Will that change? Is the Capitol going to close under this new order, and so will the right to know process change? Will state workers be teleworking now?
To the extent they can, but I'm not sure that open records is necessarily limited by teleworking. To the extent you need to have specific concrete files, I think there's still enough people who are going to be working that can do it. We'll figure out how to do that.
What about what limited it in the spring, though?
Excuse me?
I thought that was what limited the right to know in the spring, was people were working from home, and so.
Well, we had fewer people working, period. We had more people working from home, that's true. We also had fewer people working, and that put a limit on it. We needed to figure out a way to deal with this, as we did in so many other of the processes in light of this COVID-19 pandemic. And I think we've done that now, and so moving forward, I think we should be in pretty good shape. Thank you very much.
Well, good morning, everyone. I'm Dr. Grant Colfax, Director of Health for the City and County of San Francisco. Today, I'm going to provide an update on the COVID pandemic in San Francisco, looking at health indicators and other data. Unfortunately, we are experiencing a surge in COVID-19 infections that is affecting our community's health and our reopening plans. As a result, we are forced to continue to pause our reopening plans until conditions improve. We have been, and we continue to be in a period of uncertainty. And I want to acknowledge that that is a really hard place to be. We all need to continue to do what we know works. We have flattened the curve and we can do it again. But if we do not, the consequences could be dire. In terms of where we stand today, both locally, regionally, and nationally, in San Francisco, we have 4,696 cases diagnosed of COVID-19, and sadly, 50 deaths. In the Bay Area region, approximately 37,500 cases and 667 deaths. Across the state, 346,000 cases and over 7,000 deaths. And across the nation, cases and deaths continue to rise. 3.4 million cases and nearly 137,000 deaths. The virus is not only still out there, it is out there more than ever before. It continues to spread locally in our community and throughout the Bay Area region. We are working with researchers who are seeing the reproductive rate of the virus continue to climb above 1. Right now, we estimate that number is now approximately 1.3. That means that each person who is infected with COVID-19 is passing the virus on, transmitting the virus on average, to more than one person. It is key that we get that reproductive number to 1 lower. It is key for us to move forward. Now, 1.3 doesn't seem that different from 1, that far from 1, but if we do not do better, we are looking at major problems by late August and September, with an average peak of 900 hospitalized patients by early October. And just to put this in some frame of reference, on our last surge in April, we peaked at 94 cases. This average scenario of 900 cases is nearly 10 times worse, and it is certainly not the worst case scenario that we could have by that time. Models show that we could have thousands of hospitalized cases by then. Today's tracker show that there are 92 COVID positive patients in San Francisco hospitals. That includes 76 San Francisco residents and 16 transfers. Let's look at the health indicator. Let's look at the health indicators we are using to monitor our COVID-19 response in the city. These are available on the San Francisco Data Tracker, and you can reach them from our department's website. They are scored by color: green, yellow, orange, and red, to make it easier to see at a glance where we stand. And there is detailed data available for people who want to dig a little deeper. Right now, the indicators show that we have reason to be concerned. Our cases per 100,000, our case rate has increased to 7.7. That is in the red zone. Our goal is to keep that case rate at around 1.8. We are red. In terms of our hospital system, the rate of COVID-19 infections, which really represents the slope of that curve that we worked so hard and successfully early on to flatten, that rate is now increasing at a 33% rate. That is red, a cause for grave concern. Our goal is to keep that curve increasing by less than 10%. Our other hospital indicators are thankfully still green. That is our capacity to take care of people across our 9 hospital systems in the city. Right now, we have 27% of our acute care beds available and 28% of our intensive care units available. With regard to testing, our testing indicator is green. We are averaging 2,950 tests a day across the city, with our far exceeding our goal of 1,800 tests. Certainly, as we are seeing across the region, across the state, and nationally, our testing system is experiencing delays in access and getting results, both within our city system and with private providers. Our numbers, however, are high at 2,950 in the green range. With regard to contact tracing, we are at level yellow, reaching 85% of cases and 85% of contacts. We expect that indicator to turn orange this week due to delayed test result reporting and our increases in cases. The contact tracing team is working hard to catch up, and we will continue to expand staffing of that program. In terms of our personal protective equipment, or PPE, we are on level orange, with 78% of the health department having a 30-day supply of PPE. I'm sorry, let me rephrase that. Across the health department, we have our PPE supply is 78%. Our goal is 100%. We are experiencing some issues in terms of obtaining PPE, likely due to the increased national demand for PPE supplies. San Francisco is not alone in these challenges. Across California, the virus is spreading at dangerous levels, with new cases and hospitalizations on the rise. This week, the state announced a complete rollback of some reopening activities, with additional restrictions for counties on the state's watch list. Approximately 30 counties are on the monitoring list as of today, including several in the Bay Area. And we know that the Bay Area region is an interdependent region where people live, work, and play across many counties. And we also know that COVID-19 knows no county lines. If any county in the region is in trouble, we are all in trouble. That's why a regional approach has been key ever since this pandemic started, and we continue to be in very close touch with Bay Area health officers across the region, sharing data and solutions to keep all of our communities as safe as possible. And it is certainly possible that if our conditions do not improve, a rollback may be necessary in San Francisco and other parts of the Bay Area as well. Whether that's a rollback through local action or through state-determined watch list actions remains to be determined. But this is a tool that we can continue to use to improve the situation if other interventions are not working. We have always known that this is a possibility, given the unprecedented and uncertain situations we continue to face. Now, no one wants to be in the situation we're in. And as we look at the rise in cases, many of them are because people have started to gather with friends and family and others to socialize. And I realize how hard these months have been for us and the sacrifices all of us have made. These visits are really hard to resist. But the truth is that they are spreading COVID. Those birthday parties, the visits with grandparents or parents, cousins, the barbecues, They are contributing to a delay or rollback in reopening of businesses, or even the first day of school. Another key behavior that we all need to do is to cover our faces indoors and outdoors when people are around you who are not part of your immediate household. This is critical. Research shows that masking significantly lowers the rate of transmission if 80% of people wear them. Adherence to facial coverings and masking is so key. One cannot tell by looking at someone if someone has COVID-19. We know that many people are asymptomatic at some stage of their disease, and they can transmit when they're asymptomatic. Being safe, wearing facial coverings, social distancing, and using good hygiene is key to our success. The simple act of wearing a mask will slow the spread of the virus and could lead to lifting shelter-in-place restrictions. For those who are wearing masks, I thank you, and you are truly saving lives. For those who are not taking precautions, you are not helping. And the situation is becoming more serious every day. So please, wear a mask, do not gather, stay 6 feet apart, and wash your hands. These basic acts can make and will make a huge difference if we do this together. We have flattened, we even crushed the curve before. That curve is now escalating, and we all need to do better. Until then, our reopening is on pause. We are not able to continue to open up additional businesses, such as personal services, indoor museums, aquariums, outdoor swimming pools, indoor dining, outdoors bars without food, real estate open houses, and other activities that encourage people to gather and make it harder to wear masks and social distance. While it is hard to slow down the reopening that we all want so badly, the price we pay for moving too quickly is very high. Remember, this virus has no timeline. That is why it is up to us. And now is the time. Despite those very serious numbers that I reported to you in terms of our hospitalization, we have a window to make a difference. We can still drive that number to 1 or lower that reproductive number by those interventions I just went through. We have a window to do this. It will make a huge difference in our hospitalization rates and the number of lives saved. We have shown that we can join together to make a difference, and we need to do it again. Truly, the power is in our hands. And even in these uncertain times, we know for certainty what are the right steps that we need to take. We can have a thriving city with a healthy population and a renewed economy if we work together. Thank you.
Thank you, Dr. Colfax. Thank you, Dr. Colfax, in case anyone can hear me. This should be better. The first question, and I do just want to say to everyone joining us today that we did receive a number of questions, and we're going to take them in the order that they were received. And any others that we can't take in time, we'll simply take offline. Thank you for your patience. Dr. Colfax, the first question is from Christian Captain with KTVU. Can you please explain the role schools could play in the COVID-19 infection rate? The school district announced that students will be distance learning when school resumes August 17th. There has been a lot of talk on the federal and local level about getting kids back on campus. What will it take to get San Francisco kids back to class?
So one thing it will take is for us to be confident that we can reopen schools safely. for those buildings to reopen. And certainly, we are going to need to see a decrease in that reproductive rate and continue to follow the data and science to ensure that the support systems are in place, that people are able to physically distance, that people most vulnerable to the virus are protected in those settings. We issued school guidance last week, which really emphasizes the need to have safety protocols in place and followed using the best evidence we have in terms of transmission. So we will make a decision about whether it is safe to reopen those physical spaces, depending on where we stand with the virus and with our surge in the city when the time comes.
Thank you, Doctor. From Aaron Alday with the San Francisco Chronicle, the governor issued new orders this week to try to wrestle the California surge back under control. The order includes statewide closures of bars, indoor dining, and other activities, but those weren't happening in San Francisco anyway. What places or events are currently the main sources of infection in San Francisco, and how are you addressing those sources?
Yeah, so we think it's a combination of factors that are increasing the number of cases in the city. One is we think that there are clearly there's increased activity in terms of the social gatherings that people are having. And we really need to ensure that people are taking the precautions and not making those visits, not having those birthday parties, not having those barbecues, moving forward as much as possible. So really focusing on the prevention and education, neighborhood by neighborhood, street by street is going to be so critical. And we are reinforcing our work with community partners and ensuring that they're community champions to ensure that people have the resources and the knowledge they need to be safer. The other key components of this are that we continue to see infections among essential workers. And we think that may be due to certain workplace conditions where safety precautions are not being followed. So we will be looking at that and enforcing, increasing our oversight and enforcement of the required precautions per the health orders that have been established. And we are also going to be looking at our existing businesses and aligning potentially with the state in terms of some of the activities that we may need to roll back. We're taking a look at the data right now to see what's potentially on the table for that. And then I would also add that we have known since the beginning of the epidemic that crowded conditions promote the spread of the virus. So really, again, working with community members in situations where they're multi-generational households to ensure that people are getting tested and people are taking the precautions that they need to protect themselves as well as their family members.
Thank you, Doctor. From Eve Beatty with Eater SF, is the country considering a closure of outdoor dining and reverting to takeout only as a way to reduce gatherings? Are there any plans to begin to cite businesses or citizens for health order violations, as officials have ordered in Napa and Yolo counties?
So again, we're taking one thing that's clear from the data is that indoor activities are riskier than outdoor activities overall. So we know that the virus spreads more easily, more quickly in the indoors than outdoors. We're taking a look to determine whether this increase in cases is driven by some of the outdoor dining and outdoor dining. But we really think, again, this is more due to the non-adherence of some of the businesses rather than the risk that's taken, the relatively smaller risk that's there if proper precautions are taken. So, if you're outdoors and dining and drinking and not adhering to the masking and social distancing rules, then of course transmission is at a higher risk. So we're taking a look at that, and again, looking at increasing enforcement of businesses and institutions, but we're also going to be careful not to be focusing on individual enforcement of individuals, but really looking at the potential enforcement, again, of institutions and businesses that may not be complying. And before we do the enforcement, doing a lot of education and support, right? So if businesses and others, especially small businesses, are not able to necessarily comply at baseline, what can they do to improve their compliance and support their workers to be more safe during this really challenging time?
Thank you. From Amy Graff, Doctor, are you ordering residents to stop gathering outside with masks? Groups are keeping to under 10 or 12 people.
So at this time, we are encouraging people to minimize gatherings as much as possible, to wear a mask if you're in close contact with others, and to socially distance whenever possible. And certainly if people do gather in these small groups, that they gather outside is much safer. So those are the key components to this right now. And we know that there's a lot of need to improve that adherence to the facial coverings, the social distancing. I mean, I think we know, and we've seen, particularly when people know each other, they're good friends or family members, but they're not members of the immediate household. It's hard to wear a mask. It's hard to keep socially distanced. We want to hug people. We want to engage. We don't want to think that a loved one who's not part of our immediate household or a good friend may be infected with COVID-19, which is why we really need to get these messages out and support the communities most affected by COVID-19 to drop this reproductive rate below 1.
Thank you. Abby Sterling with KPIX. How will the current situation affect the decision to reopen indoor pools for summer camp?
So we have put a pause on any additional reopenings, and that would also include outdoor pools at this time.
Thank you. And from Mallory Moench with the San Francisco Chronicle, what surge sites are ready to be set up? How many beds could they add if the hospital system reaches capacity, and when will that be done?
So right now, we have adequate hospital capacity per our indicators. And again, you can go to our website and see that capacity across our 9 hospital systems. And we are in the process, as we've been for a number of weeks, preparing for a greater surge. But I really want to be clear here. We all need to do our part so that we don't get to that point. We've seen when this virus overwhelms healthcare systems, such as in New York City, as it's now doing in Arizona, Florida, and the southern part of this state, the outcomes are poor. They're much poorer. And while we've had 50 people die in San Francisco of COVID-19, and that is too many. One death is any too many. Our death rate has been significantly lower than other regions. We need to bend the curve again, not overwhelm our healthcare systems in order to move forward.
Thank you, Doctor. How will the city enforce the latest orders?
I'm sorry, I missed the first part of the question.
Last question from San Francisco Chronicle. How will the city enforce the latest orders?
Yes, so we are working across the city to strengthen our enforcement capacity, and that will be a combination of work across different city departments and agencies, including the health department and the city attorney. But if people see violations of the health order in businesses, they should call 311 and make a report, and we will send people out to investigate.
Thank you, Dr. Colfax. This concludes today's press conference.
So much to diffuse violence
for all of us joining
and
us
stop
here
it
today.
before it starts. You're going to see a lot of clergy out there this weekend. You're going to see a lot of resources provided for young people. You're going to see efforts to reach young people in new ways with a host of things they need because a lot of this is providing our young people hope and opportunity after months of dislocation and trauma that they've gone through with the coronavirus. You're going to see mobile trauma units out to provide that mental health support to people who need it in communities that have been hit so hard. All of these pieces start immediately over the next few days. Then next week, the Bed-Stuy Anti-Gun Violence Task Force gets going, bringing together a host of community organizations and leaders with the NYPD to develop a long-term strategy. So I have a real honor of presenting to you two people who have been leaders in this effort. They've worked for years and years to keep the community safe and are leading this new effort under the new reality we face to once again take back our streets. First of all, someone who I've appreciated his leadership many times. I appreciate what he's done in terms of safety and providing opportunity to his community. Also, the amazing work he did with creating on the spot the first Black Lives Matter mural in the city in Bed-Stuy. My pleasure to introduce Councilmember Robert Cornegy.
Thank you, Mr. Mayor, and thank you for convening this conversation about safety. What we believe is that while the all-out program will deploy, and which we appreciate, resources into our community that are criminal police involved, we think that we should have an all-out program as a community. So we intend to, where those hotspots are located, to provide long-term sustainable services like Jobs Plus, like affordable housing, all of the things that we have as a great city as resources and tools to people who are underserved. We plan on deploying those simultaneously while NYPD is doing their job. We intend to, as a community, do what we believe to be our job, which is to provide opportunity, sustainable movement for our communities. We've gone through stop and frisk, which the dismantling of stop and frisk, we were told that that would make a lawless city, and it did not. We actually, as the mayor mentioned, had become the safest city, and we refuse to go back. So we intend to take the efforts that were used in the past, deploy them in conjunction with the all-out program. So where these hotspots are located, make sure that services are all out for those communities. On the north side of Bed-Stuy, we have a Jobs Plus program that works with the housing developments that are on that side, Marcy, Tompkins, Sumner, Roosevelt, and have made a difference. And we want to extend that difference to the entire Bedford-Stuyvesant. So where there is an uptick in crime, we're going to have an uptick in services and really flood those areas with the necessary services. Because what we understand is that while there are depraved individuals who are pulling the trigger, society is responsible for the bullets that were loaded into that gun. And what we want to do is make sure that we can begin to dismantle these guns by providing services in this stead. So I want to thank the mayor. I want to thank the violence interrupters who've been on the ground and who are responsible for decreasing the retaliatory violence that can be seen. The family of DeVell Gardner Jr., I want to extend my condolences. I want to say thank you to the Taj Gibson Foundation, who's offered to assume the responsibility for paying for the funeral of the 1-year-old who was lost in our district. That's what community looks like. So everybody's stepping up, but we want to make sure it's sustainable. We want to work with the administration and the mayor's office. This task force, I believe, is an excellent opportunity for us to address the problems and get the resources where they need to be so that we can reduce gun violence and recidivism and all of the things that are plaguing us. This uptick right now, we can handle this as a community, as a city, if we come together.
Thank you very, very much, Councilmember. Councilmember, I appreciate what you're saying because you can hear in your voice and the way you describe the reality, something I think New Yorkers have to understand more and more, the sense of ownership that people feel in their own neighborhoods, their own community, and the sense that it is the ability of each community to change the course of the trajectory, to create peace. And that powerful thing the council member said, where there's been an uptick in crime, we will provide an uptick in services. We're not giving up ever. We're going to meet the challenge. We will never go back. We'll never allow this city to go back. And so thank you for your resolve and the resolve of so many other community leaders. And now I want to turn to someone who I think is an unsung hero, one of the people who has really helped to build the Cure Violence movement and the crisis management system all over the city. And again, this is a movement that New Yorkers need to understand better because it is about people creating solutions in their own communities. Folks who do this hard work, who've been laboring for years without renown and without resources, we're trying to do something about that now to give the support deserved. but Ife Charles has been there helping to build up SOS Bed-Stuy, but also other cure violence movements around the city. My pleasure to introduce Ife Charles.
Thank you. Thank you, Mr. Mayor, and thank you, Councilmember Robert Cornegy. I am here as a community resident, but also an advocate for the work that we do in communities. And as the mayor and Robert Cornegy, Councilmember Robert Cornegy has said so eloquently, this is about collectively utilizing the strengths that we have as New Yorkers. We are resilient and we are tough. And this is a time for us to step up. And so, yes, we have the crisis management systems across the city in all of the boroughs, but this is a call for every New Yorker to participate. And so over the past couple of days, we've had meetings and we've had marches, what we've done in our communities to bring awareness, to put the guns down, and for our communities to become safe once again. You know, someone said about taking back, we never lost it, right? So that is my attitude. We have never lost our communities, and it is our responsibilities as residents to participate. So this weekend, we're going to have these marches, and we're going to be out there. There'll be one that will be happening in Bed-Stuy, where this young child was taken. There will be one tomorrow at 5:30 at 423 Gates Avenue, so that's a call for us to be out there. The mayor has also said that we have cure violence across the city, and each one of these cure violence sites are dedicated to being out in the community this weekend, like we've been. There is no reason for us to continue to have this violence. And so as we continue moving, not only offering services to the community around mental health, around trauma, looking at job opportunities, our goal this weekend is to be out there on Friday and Saturday to saturate the community with the violence interrupters and the outreach workers and all of the members of the Cure Violence team. And that is for us to collectively, I keep using that word collectively, because this problem can be erased. It is not something that is sustainable. It is not the way that we as New Yorkers should live. We should not continue to live in fear. And I think we have the solution. This is an opportunity for us to look at the models that are working. It's an opportunity for us to utilize the people who've had lived and learned experiences and are willing to go back out there and have conversations with individuals. Councilmember Robert Cornegy just said it's a few people, right? We're a large state, 8.9 million if I'm correct, that we have all of these people in this city, most that are doing the right thing. For us at Cure Violence, for doing this model across the city, we have great people doing the work. And it is up to us as a community to be able to spread that, to change the mindsets of individuals, to continue to saturate communities around this violence. And so it is my hope that we all collectively join in this taking back, as we say, the streets, which were never lost, right? We will occupy our communities. And that is happening this weekend. And Cure Violence will be out there. We'll be out there mobilizing continuously. We'll be out there 24 hours, 7 days a week. And folks say to us, well, I don't see you. And I always say, us being absent on the street does not mean that we're not present someplace else. And sometimes that presence is us talking these individuals down for them to put this gun down. So I encourage us all as New Yorkers to participate and be out here and be a part of this movement, because you too are a credible messenger.
Thank you so much, Ife. Powerful, powerful comments. And Ife, thank you for the work you've done for years. And I've admired it for a long time. And again, to everyone, recognize community leaders who come forward. It's never easy to stop a problem in any part of our community, in any part of our city. But these are community leaders who decided the problem must stop, who believe it can and will stop, put themselves on the line, their bodies on the line to change the reality. And I want you to recognize it's not just the times that an act of violence was averted because of that intervention. It's also the message it sends to everyone else, that people can stand up and take back their community. So really, really appreciate the efforts of both these leaders and so many other leaders in Brooklyn who are doing this great work. Now, look, all of this is happening against a painful backdrop. And sometimes when we're talking about what's happening in our city, sometimes we forget, even though we all lived through it, just the sheer magnitude of what we have gone through. The greatest dislocation in the life of our city in generations, possibly the greatest dislocation ever, because of crisis layered on top of crisis. But what's so striking to me is the way that New Yorkers just don't give up. It's just not part of who we are to know how to give up. And everyone keeps fighting back. And we're going to go over the healthcare indicators in a moment. But I am astounded at how well New Yorkers have done fighting back this challenge in so many ways. Now, part of what we all have to do together is keep building this city back. We have to have that faith. Some of it is very material, what it takes to come back and restart this city. Some of it is about faith and belief and commitment. So what we owe to the people of the city here at City Hall and the city government is to keep moving forward every way we can, every way that's safe, and keep building momentum for this city to come back fully. And I have absolute faith that we will. So here is a very different subject, but one that's very, very important to the future of the city. The way we decide what this city will be in its future, the way we plan our future, the way we decide what we will build and won't build, how we're going to build affordable housing, how we're going to create jobs. It all comes back to how we plan the future of our city. And we talk about our city planning department, our city planning commission. Think about it as what it will mean for the future, not only look of the city, but where there will be opportunity, where there'll be that next affordable apartment, where there'll be that next job. That work has to begin again. So since the coronavirus hit in March, the city planning process has been suspended. The part of the process that most everyday New Yorkers haven't necessarily heard the details of, but absolutely crucial to all of our lives, what's known as ULURP, the Uniform Land Use Review process, that needs to start again. So the City Planning Commission will start remote meetings in August. Those will be open to the public, and then they will start a deeper process in September to restart ULURP projects, and review will start with community boards at the local level once again. So it's time to re-engage the city planning process and move the city forward. And anyone who wants to learn more about the upcoming meetings can go to nyc.gov/engage and learn how you can participate remotely. Okay, as we turn to our indicators, one point before that, because of course the indicators depend on what we know is so important in fighting back COVID, that's testing, testing, testing. We, in the beginning of the week, talked about what was clearly a national challenge, the delay in getting test results. In the last few days, we see some improvement. So this is preliminary data. This is not the final word, but what we are seeing now in the last few days is the test result time is starting to increase rapidly in New York City. So that's good news. We had a real trough there for a while. Again, the national lab capacity was being stretched. Right now, based on the latest information, the average, this is not everyone, but the average for test results is down to 3 days for those results. We're pushing the labs to step up. They're doing a great job meeting the demand. And the fastest testing option is through our health and hospitals and clinics, our public hospitals and clinics. And if you want to get a test, visit nyc.gov/COVID test. Now, let's do the indicators. And again, good news today. Indicator 1, daily number of people admitted to hospitals for suspected COVID-19, threshold of 200, today 66 patients. Number 2, daily number of people in health and hospitals ICUs, threshold 375, today 303. And number 3, percentage of people testing positive citywide for COVID-19, threshold of 15%. Once again, 2% today. So that shows the hard work of all New Yorkers. Keep it up. Quickly, a few words in Spanish. Estamos decididos en mantener nuestras calles seguras para todos los neoyorquinos. Este fin de semana vamos a tener más policías en Brooklyn para apoyar a la comunidad. Vamos a trabajar juntos para que Nueva York siga siendo la ciudad grande más segura en la nación. With that, let's turn to our colleagues in the media. Please let me know the name and outlet of each journalist.
Hi, all. Just a reminder that we have with us today Councilmember Cornegy, Director of Anti-Violence Programs and Capacity Building at the Center for Court Innovation, Ife Charles, Director of the New York City Department of City Planning and Chair of the City Planning Commission, Marisa Lago, Deputy Commissioner of Mental Hygiene, Dr. Hillary Kunis, and Senior Advisor, Dr. Jay Varma. With that, I will start with Juliet from 1010 Wins.
Yes, good morning all. How are you?
Good. How you doing, Juliet?
I'm okay. So, Mr. Mayor, the question is for you, this first question. We had Chief of Department Monahan on 1010 Wins yesterday. He was explaining that the department is working on a strategy to get guns off the street and to replace what the anti-crime unit used to do. What is that strategy?
Juliette, thank you for the question. Commissioner Shea and I will talk more about this in detail over the next few days, but this is the concept the Commissioner came up with, and I emphasize this is something he was not just thinking about in the last few weeks, but thinking about over months and years, the need to do this work in a different fashion. So it's taking the same officers and their abilities and applying them in a way that really pinpoints the focus on where the crime is, where the small number of individuals, and I keep coming back to this. Remember when Bill Bratton told me this for the first time, it was like a light bulb going off for me. And a city of 8.6 million people, it's a few thousand people who are really responsible for the worst violence. So pinpointing them more effectively with a variety of tools, creating more effective prosecutions, working with DAs, particularly around gun violence, more effective gang takedowns, and less of a friction with communities. Because some of the efforts of the anti-crime unit unfortunately mirrored some of the reality we saw with stop and frisk, where people were confronted who were not the folks who were doing the crime. And even though, again, that unit did some very good and important work, there's a better way. I also emphasize, Juliette, I believe the number is about 800 officers out of a force of 36,000. And all of our officers are involved in anti-crime work in different ways. So we'll have more to say on that going forward, but I think we can do this in a better way and keep the city safe while doing the most fundamental thing, which is what you heard about here, building a different and better relationship between police and community. Go ahead, Juliette.
Yes, okay, so that's actually a great segue to my next question, and maybe I can address this to the council member Cornegy and Ms. Charles. How do you reach these gang members with guns, and how do you convince them to put the guns down? Because that appears to be the predominant violence, these drive-bys, these shootings on the street. You know, are you just preaching to the converted already? How do you get through to the people with the guns in their hands?
So first of all, I think we have to take the approach that violence overall is a public health issue. And while we see these flashes of gun violence, really domestic violence is up tremendously. And the NYPD would corroborate that. So I think the services being provided that haven't been provided before consistently are a sustainable way to begin to reduce the amount of violence in general, but certainly gun violence. Opening up the parks again, which is right on the horizon, obviously. Opening up our youth centers, which is on the horizon. The pandemic, it cannot be underestimated how important the pandemic has been just to people's psyche and their mentality and their ability to get out. There's no excuses for violence, especially gun violence, but there are contributing factors that will be studied in the future about the mental health of people. So I think continuing to coordinate services in our communities, like Ife mentioned, making sure that we're consistent and have sustainable messages around employment, around affordable housing, around undereducation and good quality school systems. If we continue to do that, we will, in conjunction with the NYPD and reducing crime, but making that sustainable. So it's a coordinated effort that I look forward to engaging in over the next few days.
Thank you, Councilmember. And I want to turn to Ife on particularly one of the things Juliette said. I really appreciate the question. Because again, is it preaching to the converted? Well, I've seen it's anything but preaching to the converted, that you're dealing with folks who are unfortunately caught up in that life of violence and trying to pull them away from it. I've talked to some of the people who have come away from that life because of Cure Violence. But if you could talk about, just take us there, take us to the grassroots level, what it means to intervene with someone and help them to a different path, and what the challenges are of that.
In fact, you know, part of this work, I think people have this notion that this happens immediately, right? It does not. It's a layer, and I call it a layer of strategizing around helping someone who is in that mindset. And it does not happen overnight. And so identifying where or what those beefs are, what those current conflicts are, and then start to work with parties in those conflicts. And some of this stuff may be historical, Mayor. Some of it may be attitudes post this COVID that we've talked about, right, the pandemic. We're talking about a group of individuals, not many, who are struggling. And for them, into conflict, the only thing for their attitudes to deal with this is to pick up a weapon. Our goal always is to have folks have conversations about what is driving this feeling. And then in that process, work with them, because you just can't work with the individual. You have to work with their network. And so when we talk about strategizing, you can't go out there and just say to someone, put the gun down. Right? Because people believe that's what you automatically do. No, there's got to be layers of conversations. You have to understand where the source of the argument is coming from. And once you understand where that source is, you realize there are other parties. Now, our credible messengers, there are some. And I always say to folks, we have 36,000 police officers, and we have about 300 cure violence workers. Right? If you think about the ratio of cure violence workers to police officer and the capacity, the area of where we're covering, at times we have to go in and spend time with the individuals for them to trust. You may have relationships with these individuals, but at that particular time, what they're experiencing, we may not be able to understand. And it will take an opportunity for us to be there with them long term. And then that trust is built. And then we have other avenues to give to them. Take my gun and do what? Is the question that many ask, right? And so for us, to my gun, and here is another opportunity for you. Here is some mental health services. Here is the opportunity for some job training. Here's the opportunity for some long-term job employment. These are the things that we're trying to get for our young people and the individuals that are in these particular gangs or in these particular sets that we're working with.
Yvette, I'll just pull out one more point of this and tell me if you have this at the top of your mind, or else we'll come back. I think Juliet's question is really important and really earnest to try and help New Yorkers understand. Is there a specific example that sort of you've cherished of someone who was in the middle of that life of violence who you witnessed the process of how they were convinced on a better path? Do you have an example in your mind?
We have staff. I can speak of one of our staff. And I hope she's okay with me. I'm going to use her first name, Faith. And this is how long sometimes this works. And we are in a situation right now where we need to happen expeditiously. And we have to think about how we do it, because then people will revert back. Faith is a 30-something-year-old young woman. But Faith was that person out in the streets years ago. When I was young, I was in my mid-20s or 30s. I'm giving my age right now. But part of that was that I had to work with Faith along with other credible individuals that were out there every single day, Mayor, running in my car to get her off the street corners. It took years. And even in that time, I remember when she turned and she had her first child and she said to me, I'm not ready yet. Because you can force someone to something and then they revert back quickly. And 10 years down the line now, Faith is now an employee, right? She's actually working with us. But it took years of us having conversations and her doing trial and error. You didn't want to be in school. What is the alternative to that, right? What else can we do? Now you have a young woman who has said, I don't want this life anymore. This is not what I want to do. But it did not happen overnight. And if we're thinking that this is going to happen overnight because we want it to, it is in our hearts. We no longer want shootings. We're telling everybody put the guns down. But there's got to be some alternatives to that. And that work happens every single day. You don't get a break from it. Changing the mindset of someone, you cannot get a break of it. When I think about the work that we do, I think about, Narcotics Anonymous. You have a sponsor. And you're able to reach out to that sponsor. And it's the responsibility of the sponsor to work with you continuously, even when you fall. Because automatically when someone falls, we want to say they're out. And that is not the attitude we have with this work, because people are going to fall numerous amounts of times. If I was to ask anyone in this room, have you made mistakes? You have. But you've also had people around you to support you. And that's what we're saying. We're not saying to give people free stuff, constantly, we're saying, here is a model, here is a pattern, and we mimic and model the behavior, Mayor, right? We've all been there. We mimic and model behaviors and allow them to be exposed. A lot of our young people have not been exposed to other ways of life. And so our role in this work is exposing people to an opportunity other than what they know.
Amen. Beautifully said. Thank you so much, Ife.
Next, we have Katie from the Wall Street Journal.
Oh, hey, Mayor de Blasio. I have just a question, and it's inconsequential after what we just heard. But I'm curious. I know there have been quite a few number of your own staff who are leaving, and I'm curious. I know there's a citywide hiring freeze, but is there a hiring freeze for the mayor's office, or are they exempt? I know that some of them have been replaced, and I was curious how that works.
Yeah, Katie, we are in the middle here of putting into effect some cuts to our budget as a result of the budget that was passed at the end of June. There's a hiring freeze citywide. There's obviously an exemption for things that are related to addressing the COVID crisis and the most basic functioning of government. So it really depends on the position. But we are reducing the number of positions we have overall, but some roles just have to be filled as part of the basic functioning of this place.
You can go ahead. I don't have a second question. Thank you.
Thank you.
Next, we have Michael from the Daily News.
Michael.
Morning, guys. How you doing?
Good. How are you?
I'm good. So a quick question on the uptick in COVID cases among young people, 20 to 29. Is there any more information on this? Erin asked about this yesterday, and I'm wondering, has the Tracing Corps found any connection to the protests? Any connection to some of these illicit parties? I think that were reported on today. Any clues as to kind of what's driving this at this point?
I'll turn to Dr. Varma. Again, I think we're seeing this, Michael, around the country. I do think the crisis has hit younger people in a really challenging way, and they've been just yearning to get out, and they're used to, a very outward-focused life. And I do think you're seeing around the country, like when the bars and restaurants reopened, first and foremost, it was younger folks going out. I don't know if we can parse exactly parties, protests, whatever, but I do think it's part of the reality of what young people are responding to after a long period of time where they had very, very limited options. But Jay Varma, tell us again if we have any more detail either from our own research locally or nationally on that.
No, nothing more for me to add. I mean, I do think that we're going to continue to learn more as we do these investigations and understand what the connections are. And for now, the highest priority is to keep strengthening our messaging to people from every background, particularly those who are between 20 and 29, about the importance of wearing face coverings, keeping social distance, avoiding large gatherings, and also, of course, trying to get tested as frequently as possible, especially if you feel like you had an exposure.
Yeah, and I want to just do one addition to this point for Jay to answer. Dr. Varma, you obviously have studied different outbreaks and all around the world. Is there also potentially a problem of younger people feeling somewhat impervious? Can you hear me?
Dr. Varma? Oh.
There you go. Dr. Varma,
Can you hear me now?
There you go.
Okay. Yeah, absolutely. I think that, this is actually something that we anticipated would happen, very early on. Before I got to New York, I was actually in Africa working on continent-wide strategy. And we knew very early on that the disease has much more severity in people who are older, but that the sacrifice would need to be made by everybody in society. So by definition, we knew it was going to be more challenging for younger people because they need to sacrifice a lot, even though their individual risk of getting severe disease is low. And so we see that situation, I think, everywhere in the world. Where there is a certain amount of what we call epidemic fatigue, where you're being expected to change your behavior in every aspect of your life. And so it's one of those challenges that we're just going to continuously have to face in terms of messaging and outreach and being very responsive to the needs of people in all age groups, because this is a sacrifice that we're all going to have to make.
Well said. Michael?
Yeah, one more. When are you planning to sign the anti-chokehold bill? Do you have a date set on that yet?
Yeah, it's a package of bills, Michael. I'll be signing all of them later on today.
Next we have Julia from the Post.
Good morning, Mr. Mayor. How are you doing?
Good. How are you, Julia?
I'm pretty good. When the coronavirus crisis was the biggest issue in the city, you had health officials join you in your daily briefings. Now that this terrible violence is the news of the day, there are rarely, if ever, NYPD brass involved on these panels. I'm wondering how you can talk about curbing violence without any input from officials in the police department. You just mentioned that Shea wanted these extra deployments, but he's not here to discuss it.
Julia, we do different things different days. What has been so important to do in the last few weeks is to emphasize the role that community leaders are playing, which honestly doesn't get the attention it deserves. So this is a purposeful effort on my part to show the people in New York City there are so many community leaders, so many organizations out there doing this work, and this is going to be central to how we approach it. NYPD, as I said, Commissioner Shea and I will have a lot more to say on the new strategies going forward. We'll address them, but everything that I talk about is based on my conversations with the commissioner and his team all the time. But this is about trying to show the people of the city the community piece of the equation, which honestly gets left out of the public dialogue way too often.
But, you talked about how much, for instance, you respect Chief Monahan's experience for kneeling with the protesters. And then, he's blamed the uptick in shootings on this disbanding of the anti-crime unit, the defund police movement, said cops are hesitant to make arrests, all of which you disagree with. But don't you think it's important for the public to hear from him, who's an expert on law enforcement?
Public has heard from him, and I have great respect for him. He and I have worked really closely together for years, and I'll remind you, he became chief of department during my administration, so that's of the respect I have for him. I don't agree with him on everything he said, but I respect his right to say it, to express his honest concerns. But he and I have talked about this many times. We're moving forward with the strategies that make sense for this whole city, for all communities of this city. You can listen to someone and respect their experience, but also disagree. I believe the truth here, I've said it before, I'll say it again, is we're dealing with a perfect storm that is more than any one factor. It's more than any recent decision. It is much more about the total impact of the coronavirus, the dislocation it's caused in people's lives. And I really ask everyone to have the intellectual honesty to acknowledge that when people don't have jobs, over 1 million people lost their jobs in the course of weeks, no school, no activities, and the court system's not functioning. The criminal justice system's not functioning. Come on, that is the foundation of what we're going through here. And anyone with eyes to see can understand that.
Next we have Jillian from WBAI.
Hi, Mr. Mayor. How are you doing?
How are you doing today?
I'm well, thank you. I have my first question is for both you and Councilmember Cornegy. One of the best ways to affect change is through employment, and small businesses are the largest employer in New York City, but there's a huge crisis in their closings that predates the virus. Commercial tenants have no rights, especially regarding leases, and the only real legislation that could help, one of the most vetted bills in council history, is the Small Business Job Survival Act, which the mayor used to support when he was in the council. Why is this bill still languishing?
Hey, Jillian, just clarifying, because different have different names over time. I assume you're talking about commercial rent control, right?
No, it's commercial rent arbitration.
Oh, I'm sorry, commercial rent arbitration. Okay. So as you remember, in the State of the City, I said we need to once and for all try to address the legal problem that's existed with commercial rent control. Because I did support that idea originally and then came to feel after talking to a lot of legal experts who were very sympathetic to small business that it just wasn't legally tenable under our current laws, and we were trying to figure out a new approach. I need to get up to date on the rent arbitration issue, so I promise you I will give you a clearer answer on that. But in the meantime, what we're trying to do is help small businesses to get access to everything that's out there. It's not enough, but there still are grants that we've created, loans, the federal programs, different philanthropic programs. We're trying to help them with legal services, and this is something that predates COVID. That if a small business is having a conflict with a landlord, we can get them free legal services to protect them through small business services. Obviously, doing everything we can to stop them from experiencing fines. And then we're helping specific businesses to get up and running in every way we can, obviously, especially what we've done recently with restaurants, but many others as well. But on the rent arbitration issue, I will come back to you on that.
For me, we introduced several bills in my first term. One was the commercial tenant harassment bill, which, like the mayor mentioned, does provide a recourse for commercial tenants, the first in the country, if they're harassed by their landlords and forced to move. And it provided also money for legal expenses. And then we also created the Chamber on the Go, which actually takes the city services right to the commercial corridors throughout the city and provides access to capital and technical assistance. And in regards to the bill that you mentioned, I believe that is being reintroduced by another one of my colleagues.
Go ahead, Jillian.
Okay, well, I'm going to follow up because nothing that you guys have talked about really addresses the lease issue. Capital is great. Legal services are great, but they don't talk leases. And small businesses need to plan, and they need to be able to plan for more than a year or two ahead. So this bill is the only one that lets them do that. And so if you need to take a look again, but it's been introduced since the 80s. So, I mean, we're past the point of crisis now.
Yeah, I would also say, Jillian, I appreciate the point. And again, I will get you an answer on that, but I want to come back to the underlying reality. We have small businesses going through immense stress right now. I'm very, very worried about the small businesses that may not be able to make it through, and I think that's disproportionately happening in communities of color. At the same time, I have a lot of faith and respect that a lot of small business owners are going to find ways to fight back. There's a lot of resiliency and entrepreneurship. What's the unknown right now, Jillian, is what is the market going to be like as we are coming back? I mean, this recovery is going to take years. I think it's safe to say that the commercial rental dynamics are going to be very different. And what I am hoping for, and this is not to say, hope replaces legislation, but I want to make this point. I'm hoping that landlords out there understand that if they're disrespectful to their tenants, if they try and remove their tenants or not give them an opportunity to pay over time or whatever accommodation can be made, I don't think it's likely you're going to get new tenants right away. So it's just a common sense point. Everyone's going through this crisis together. It's going to take a while to rebound. The best thing is for landlords to show a lot of understanding and respect for the small businesses. Help them get through, because it's the right thing to do. It's the right thing to do for the city. But also, I think it's the smart thing to do, because if you do not work with a small business, you kick them out, I don't know who's going to replace them right away. So I hope landlords are thinking both compassionately and pragmatically in that case.
Next, we have Henry from Bloomberg.
Hello, Mr. Mayor. How are you doing today?
Good. Henry, how you doing?
I'm okay. I'd like to ask you a question about the city revenue since you produced the budget. Do you have any new indicators about how the revenue is doing compared to projections?
Now, where we left it, and I believe it was May 25th or 26th, $9 billion loss between fiscal 20 and fiscal 21. Henry, I'm very worried that will get worse. We tried to do a conservative estimate, but I'm worried that's going to get worse. I'm also very worried about potential state cuts to our budget. So I do not have an update for you in the coming weeks as we see what happens, particularly with the stimulus. We'll be speaking more and more about where things are going. But I think, the $9 billion to begin with is just a staggering figure and a very sobering one. Go ahead.
Okay. There have been so many cases in which police have acted with excessive force. I mean, the story in the Times today is just one example. But there are a lot of examples in that story. And I'm just wondering whether you're taking another look at the police training that you were so proud of and thought was going so well, that maybe it wasn't as effective as you thought, and maybe it has to be rethought.
I appreciate the question. No,
Maybe
go ahead. I'm sorry.
The question is, are you reconsidering that in light of all of the incidents that show police using a lot of force against people, excessive force?
Yeah. So, Henry, unquestionably, we're going to constantly reevaluate. We have to. That's the nature of the training. I really want to emphasize this. And First Deputy Commissioner Ben Tucker leads that effort, and the team around him. It is meant to be constantly evolving. Remember, it started as de-escalation training and grew from there to the point that now every officer is retrained throughout the year on a host of matters, including implicit bias. And that's something that was brought in over the last couple of years. And then there'll be more and more additions as we go along. So, yeah, we have to rethink it all the time based on what we're seeing. I keep coming back to the fact that overwhelmingly, and I think the facts show it, officers have learned from that training how to de-escalate. The vast majority of officers do honor that training. There have been some really troubling incidents, and for those incidents, there has to be consequences, and there will be. And we'll constantly update the training, but I want to come back also to the most powerful use of force question, which is gun discharges. And again, I don't know why good news is not reported. This is one of the things I will go to my grave asking. But I've said it out loud many times, and I've never seen a big blaring headline about it. 2018, I believe it was the right year, adversarial gun discharges by NYPD officers, 36,000 members of the force, 365 days in a year, 8.6 million New Yorkers. There were 17 adversarial gun discharges. And that means in situations where someone points a gun at an officer, someone points a gun at another person, and an officer uses their weapon to stop it. That's an astoundingly low figure for the biggest city in America. That came from the work that First Deputy Commissioner Tucker and his team did in that training to teach tremendous restraint. So we definitely got work to do. I'm not using that fact to belittle the challenge, Henry, but I do want to put things, first things first. That is an astounding level of progress, and that means something is working. Now we just got to figure out how to do even more and better.
Last two for today. Next we have Susanna from Cranes.
Good morning, Mr. Mayor. I wanted to ask about phase 4 of reopening. New York City is currently the only region in the state that's not entered the phase, and come Monday, we're approaching that 2-week point that separated phases previously. So I wanted to know when we can expect to enter phase 4. What are the metrics do we have to meet to do that?
Susanna, phase 4 is being deliberated right now between the city and the state. I want to give you an update tomorrow, or worst case Friday, of where we are. This one is a little more complicated for several reasons. First of all, of course, some of phase 4 is already spoken for, in that, for example, with the sports teams that are starting up without audiences, that's already been decided by the state. Other pieces of phase 4 have been spoken for the other way. For example, a number of colleges and universities have already announced that they're not going to do in-person classes or activities. So this one's a little different from the other ones in that a number of pieces have already been determined. But at the same time, there's still a substantial amount of activity that needs to be adjudicated. And I know the state is looking at this the same way we are. We're looking at this national reality of the uptick and looking at it very soberly. How many states are going through a horrible uptick right now? And we all agreed on, the concept in phase 3 of holding back the indoor dining. So we got to decide how we feel about the different pieces of phase 4 and if we really are ready for Monday or, a different approach or a different timeline. So we'll have an update for you in the next 24 to 48 hours. Go ahead, Suzanne.
Thanks. And when we do enter phase 4, it seems like it might be a bit more of a piecemeal process. Are there certain industries that you expect to be left out? And will those be brought back in sort of a phase 5?
Well, that's exactly the question we're deliberating. These phases, I think, are thoughtful, but they're not, they weren't handed down on stone tablets, on a mountaintop. I mean, they're based on what we're experiencing, and we make adjustments as we go along. So it's perfectly conceivable. And going back to phase 3 again, the indoor dining, that's on hold until a point that we feel it's acceptable. We have not put a timeline to that. So we may say for phase 4, some things are going to float while we figure out what makes sense. But it's going to be specific to each of the pieces. Again, you already see some real decisions having been made about phase 4 practically, either by the state or by the organizations themselves. So I'm not going to be shocked if we have a kind of split situation. I'm not going to be shocked if we have a defined timeline for delay, or we say, hey, this piece is just going to have to wait until we get further information. But again, we'll come back with something more solid in the next day or two.
Last one for today. Next, we have Fred from WNYC.
Good morning, Mayor. How are you?
How you doing?
Good, thank you. Quick question about school-based health centers. Of course, they remain closed in New York City, like the schools themselves. However, outside the city, hundreds of them are open. And I talked to some of your folks yesterday. They said they're working to get them open with all deliberate speed as quickly as possible. I wonder if you could elaborate on what is keeping them from opening. Obviously, they wouldn't necessarily need to. There are hundreds of them. They're sponsored by NYU and Montefiore and the federally qualified health centers. You would need to open all of them clearly, but many physicians, many public health leaders are eager to get at least some of them open to catch up on vaccinations, serve other primary care needs in underserved communities.
Thank you for the question, Fred. And I always like to open when I don't have the exact details on something. So I don't know what the current thinking is and how it correlates with the effort to get school open, which is now about 8 weeks away. So let me just see if Dr. Varma or Deputy Commissioner Koonens has an update on that. Either one of you?
Dr. Varma?
Dr. Varma, if you're talking, we can't hear you. Or Dr. Koonens, if you're talking, we can't hear you.
Oh, I think Dr. Koonens is jumping in.
Mr. Mayor, no update. We'll have to get back to you.
Okay, Jay, is that the same for you? I take that as a yes. Okay, Fred, we owe you an answer back on that later on today.
Fred, do you have a follow-up?
No, I'll look forward to hearing from you or your office, elaborating on and getting a little past just we're doing it as quickly as possible, but really elaborating on what some of the specific impediments are, please.
Yeah, and thank you for the question. And obviously, we've wanted to get as many community-based health options strengthened as we go forward. So I appreciate the question. We'll get you an update. Everybody, let me just finish up today right where I started. It was inspiring last night. It was inspiring to be in East Harlem with people who cared so deeply about their community and were coming out to say that they were going to make sure their own community was safe. And you could hear it in the voice of Councilmember Robert Cornegy. You could hear it in the voice of Ife Charles and her very eloquent explanation of all the efforts being made. Folks feel ownership in their own communities and are going to make sure their communities are safe. This is the piece of the puzzle that in some ways is most foundational. And you're going to see this summer more and more communities come out to create the reality they need for themselves and their young people, and we will be with them every step along the way. That is what New Yorkers do. Thank you, everybody.
Today. So
You've heard me say many, many times that it's important that every single one of us do our part by masking up and fighting this virus, and that it really has to be a team effort where we're all on the same team. As you can probably see, the Lieutenant Governor has a U of M mask on. I brought my Spartan mask. But it's also why we've asked leaders from different universities in this state to come together, and people who know a little bit about teamwork to work with us to make sure that the public understands how important it is that we all wear masks. So with that, I'd love for you to take a look at this video.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green or blue.
But one thing we can all agree on, to help stop the spread of COVID-19, wear a mask.
Wear a mask.
Wear a mask.
Wear a mask. Wear a mask.
The ball's in your court, Michigan.
All right, so this is a part of our campaign to make sure everyone masks up. It's time to wear a mask. And some of my friends who were in that video are joining us today, so I'd like to welcome them up to the stage. All right. They're making their way up. A few of our coaches from two of our phenomenal, many universities, but two of our phenomenal universities are represented today. First, I would like to welcome Coach Susie Merchant, the coach of Michigan State University women's basketball team. Coach Merchant is entering her 14th season as head coach of MSU's women's basketball program, has nearly 500 career wins, bringing the Spartan program to the upper echelon of the Big Ten and the national level. She's also, she was an assistant coach with USA Basketball and helped the team win a gold medal at the World University Games. With that, I'd like to welcome Coach Merchant to the podium. Come on up, Coach.
Thank you, Governor. I appreciate that. Hello, everyone. First and foremost, I am delighted to be here today, and just truly want to say to all the Michigan folks out there that today I'm here because we're not Democrats or Republicans.